NCLEX PN Archer Review Part 2. Question 1. The nurse is caring for a female client who is incontinent of urine. The MD orders an indwelling Foley catheter to be placed. Place the following actions in the order that the nurse takes to correctly insert the Foley catheter. Choices. The nurse will secure the catheter to the client and place their initials, date, and time on the securement device. Lastly, here are the options. Option A. 1. Perform hand hygiene, identify patient, explain procedure, and wear sterile gloves. 2. Spread the labia and hold them open. 3. Cleanse the meatus from front to back on the right side, then left side, and down the center. The correct answer is option A. 1. Perform hand hygiene, identify patient, explain procedure, and wear sterile gloves. 2. Spread the labia and hold them open. 3. Cleanse the meatus from front to back on the right side, then left side, and down the center. Correct answer. 1. Perform hand hygiene, identify patient, explain procedure, and wear sterile gloves. 2. Spread the labia and hold them open. 3. Cleanse the meatus from front to back on the right side, then left side, and down the center. Second, the nurse uses her dominant hand to cleanse the meatus from front to back on the right side, then left side, then down the center. Question 2. The nurse is assisting in the placement of an indwelling Foley catheter in a male client. The nurse knows to inflate the balloon on the catheter at which of the following points in the procedure? Here are the options. Option A. Upon meeting resistance. Option B. As soon as urine is observed in the tubing. Option C. After advancing to the point of bifurcation. Option D. After fully advancing the length of the catheter. The correct answer is option C. After advancing to the point of bifurcation. Correct answer. After advancing to the point of bifurcation. The nurse should inflate the balloon on the catheter once she reaches the point of bifurcation. This is achieved by slowly advancing the catheter, observing the tubing for urine to appear, and then continuing to advance to the point of bifurcation after urine is observed. This will ensure the balloon is in the bladder before the nurse inflates it. Question 3. A patient who is 2 days postoperative from right femoral popliteal bypass surgery complains of worsening right leg pain. Upon assessment, the nurse notes swelling and ecchymosis at the incision sites. Which action would be the nurse's initial priority? Here are the options. Option A. Apply pressure to sites with a sandbag. Option B. Palpate pedal pulses. Option C. Assess for signs of claudication. Option D. Apply a warm compress to the incision sites. The correct answer is option B. Palpate pedal pulses. Correct answer. Palpate pedal pulses. The most significant complications that this patient is at risk for after the revascularization procedure are thrombus, hemorrhage, infection, and arrhythmias. Mild to moderate swelling, bruising, and pain at the surgical site are expected and typically resolve over time as the leaked blood is reabsorbed. The most important action would be to assess the patient's pedal pulses distal to incisions. If pulses are intact, the nurse would then address the patient's complaint of worsening pain. Question 4. The nurse assesses each of the following on a 12-year-old female. Which of the following growth milestones are expected for female adolescents of this age? Select all that apply. Here are the options. Option A. Menarche the larch. The correct answer is option A. Menarche the larch. Correct answer: menarche, the larch. Menarche is defined as the first occurrence of menstruation or the first time a girl gets her period. This is one of the most important milestones of female adolescence. It typically occurs about 2 years after the larch, or the beginning of breast development. The larch is defined as the beginning of breast development at the onset of puberty. This is a significant milestone for female adolescents. It can occur anywhere between 8 years of age and 13 years as there is substantial individual variation. Question 5. The licensed practical/vocational nurse LPN/VN is reinforcing teaching to a client prescribed iron supplementation. The nurse should instruct the client to select all that apply. Choices: take the iron supplement with a meal rich in calcium. Drink a glass of orange juice with your iron supplement. Report any black stools to the physician. Drink iron suspension with a straw. Increase dietary fiber intake because of the potential for constipation. Here are the options. Option A: drink a glass of orange juice with your iron supplement. Drink iron suspension with a straw. Increase dietary fiber intake because of the potential for constipation. The correct answer is option A. Drink a glass of orange juice with your iron supplement. Drink iron suspension with a straw. Increase dietary fiber intake because of the potential for constipation. Correct answer: drink a glass of orange juice with your iron supplement. Drink iron suspension with a straw. Increase dietary fiber intake because of the potential for constipation. Question 6. The nurse cares for a client with a potassium of 5.7 mg/L 3.5-5 mg/L. Which conditions can cause hyperkalemia? By select all that apply. Choices: Cushing's disease, nasogastric tube suction, salt substitutes, hyperinsulinism, adrenal insufficiency. Here are the options. Option A: salt substitutes, adrenal insufficiency. The correct answer is option A: salt substitutes, adrenal insufficiency. Correct answer: salt substitutes, adrenal insufficiency. The client's high potassium level, 5.7 mg/L, is concerning. Salt substitutes contain potassium, which makes them more palatable. Excessive intake may lead to hyperkalemia. Adrenal insufficiency causes hyperkalemia because of the insufficient amount of aldosterone, which causes potassium elimination. Less aldosterone and less potassium elimination equates to hyperkalemia. Question 7. The nurse is performing a physical assessment on a client with Cushing's disease. Which assessment findings should the nurse expect? Select all that apply. Choices: hypotension, acne, hirsutism, buffalo hump, truncal obesity. Here are the options. Option A: acne, hirsutism, buffalo hump. The correct answer is option A: acne, hirsutism, buffalo hump. Correct answer: acne, hirsutism, buffalo hump, truncal obesity. Question 8. The licensed practical/vocational nurse LPN/VN reviews the function of a prescribed beta blocker in the cardiovascular system. It would be appropriate for the nurse to state that beta blockers select all that apply. Choices: block catecholamines from binding to the beta receptors, reduce myocardial oxygen demand, increase cardiac contractility, increase cardiac output. Here are the options. Option A: block catecholamines from binding to the beta receptors, reduce myocardial oxygen demand. The correct answer is option A: Block catecholamines from binding to the beta receptors reduce myocardial oxygen demand. Correct answer. Block catecholamines from binding to the beta receptors reduce myocardial oxygen demand. Beta blockers decrease blood pressure by causing vasodilation of the vessels. They block catecholamines from the beta receptor sites found in the heart and lungs. Beta blockers decrease the heart's workload through vasodilation and lowering the heart rate. This relaxation of the vasculature and reduction in heart rate will reduce the myocardial oxygen demand. This is why beta blockers' low doses may be prescribed during an acute and afterward. Question 9. You are taking care of a client who is postoperative day 1 following a mitral valve replacement. He is getting ready to ambulate for the first time. His heart rate is 102 beats/minute, and the stroke volume based on the echocardiogram is 72 ml. What is his cardiac output CO? Here are the options. Option A, 7.344 L/min. Option B, 30 L/min. Option C, 55%. Option D, 73.444 ml/min. The correct answer is option A, 7.344 L/min. Correct answer, 7.344 L/min. CO equals heart rate HRX stroke volume SV. To answer this question correctly, you must know the right formula for cardiac output CO. Question 10. The nurse reinforces discharge instructions to a client who underwent left eye cataract surgery with a lens implant. Which statement by the client would indicate a correct understanding of the teaching? Here are the options. Option A, I should avoid getting water in the eye for 3 to 7 days after surgery. Option B, it is okay for me to resume normal chores such as vacuuming. Option C, it is okay for me to have green or yellow, thick drainage from the eye. Option D, I may take aspirin for any pain I may experience. The correct answer is option A. I should avoid getting water in the eye for 3 to 7 days after surgery. Correct answer. I should avoid getting water in the eye for 3 to 7 days after surgery. This statement indicates effective teaching by the nurse. Following cataract surgery, the client should not get any water in the affected eye for 3 to 7 days. This measure will reduce the potential for infection. Question 11. Which form of therapy would most likely be used to treat a group of clients affected by phobias? Here are the options. Option A, behavioral psychotherapy. Option B, cognitive behavioral psychotherapy. Option C, psychoanalysis. Option D, cognitive psychotherapy. The correct answer is option A, behavioral psychotherapy. Correct answer, behavioral psychotherapy. Behavioral psychotherapy is useful for clients who are adversely affected by phobias, addictive disorders, and substance-related disorders. Some of the techniques used with behavioral therapy include operant conditioning as put forth by Skinner, aversion therapy, desensitization therapy, modeling, as well as complementary and alternative stress management techniques. Question 12. The nurse is conducting a health screening at a local health fair. Which of the following should the nurse recognize as a risk factor for developing testicular cancer? Select all that apply. Choices: cryptorchidism, vasectomy, family history, herpes simplex virus, HSV, human immunodeficiency virus, HIV. Here are the options. Option A, cryptorchidism, human immunodeficiency virus, HIV, family history. The correct answer is option A. Criticism, human immunodeficiency virus HIV, family history. Correct answer, criticism, human immunodeficiency virus HIV, family history. Question 13. The son of a client with early Alzheimer's disease states, "I'm so tired of hearing Dad talk about the past all the time." What is the nurse's best response? Here are the options. Option A. You should have more patience with your father and accepting of his disease. Option B. He is quite anxious at this stage. Reliving the past helps him become calm again. Option C. He has lost his short-term memory but can still remember events from long ago. Option D. Just remind him when he repeats himself, and that will reinforce better behavior. The correct answer is option C. He has lost his short-term memory but can still remember events from long ago. Correct answer, he has lost his short-term memory but can still remember events from long ago. Family members can become frustrated when clients with Alzheimer's disease lose short-term memory. The nurse should explain to the family member that it is the short-term memory that is declining and encourage the client to talk about things that he/she can remember. Question 14. The nurse is assessing a client with diabetic ketoacidosis DKA. Which of the following would be an expected finding? Select all that apply. Choices: thready pulse course tremors, tachycardia, orthostatic hypotension, jugular venous distension, JVD. Here are the options. Option A. Thready pulse, tachycardia, orthostatic hypotension. The correct answer is option A. Thready pulse, tachycardia, orthostatic hypotension. Correct answer, thready pulse, tachycardia, orthostatic hypotension. Question 15. The nurse has attended a staff education program about managing clients with peripheral arterial disease. Which of the following statements by the nurse would require follow-up? Here are the options. Option A. The client should engage in a daily exercise regimen. Option B. Smoking cessation is an essential treatment goal for clients who smoke. Option C. Resting in a recliner with the legs dependent should be recommended. Option D. Devices that elevate the legs above the heart should be provided at discharge. The correct answer is option D. Devices that elevate the legs above the heart should be provided at discharge. Correct answer. Devices that elevate the legs above the heart should be provided at discharge. Is caused by conditions such as hypertension, hyperlipidemia, and diabetes mellitus, which cause atherosclerosis of the peripheral arteries. This impeded blood flow may cause the client to experience intermittent claudication pain with ambulation that is relieved with resting. The client should be educated on self-management strategies, including sleeping or resting with the legs dependent below the heart to facilitate blood flow and not wearing constrictive clothing that may further impede blood flow. This statement requires follow-up because the client's legs should be below the heart to facilitate blood flow. Question 16. Among Erickson's stages of development, which of the following development stages would the nurse expect for her 4-year-old client to be in? Here are the options. Option A. Trust versus mistrust. Option B. Initiative versus guilt. Option C. Identity versus role confusion. Option D. Industry versus inferiority. The correct answer is option B. Initiative versus guilt. Correct answer. Initiative versus guilt. Initiative versus guilt is the typical development stage for preschool children who are 3 to 5-year-olds, so this is correct for your 4-year-old client. In initiative versus guilt, children start to assert control and power over their environment. Success leads to initiative when they feel a sense of purpose, but children who try to exert too much power and experience disapproval end up feeling guilty. Question 17. The client using over-the-counter nasal decongestant drops reports unrelieved and worsening nasal congestion. What is the appropriate instruction for this client? Here are the options. Option A. Discontinue the medication for several days. Option B. Use a combination of oral medications and drops for better results. Option C. Switch to a stronger dose of the decongestant drops. Option D. Increase the frequency of the nasal decongestant drops. The correct answer is option A. Discontinue the medication for several days. Correct answer. Discontinue the medication for several days. Rebound congestion. Question 18. This nurse is caring for a client who is receiving prescribed hydralazine. Which of the following findings would indicate a therapeutic response? Here are the options. Option A. Blood pressure 130/70 mmHg. Option B. Pulse P67/minute. Option C. Total cholesterol 185 mg/dl. Option D. A PTT 45 second. The correct answer is option A. Blood pressure 130/70 mmHg. Correct answer. Blood pressure 130/70 mmHg. Hydralazine is a vasodilator and is intended to treat hypertension. The client's blood pressure of 130/70 mmHg is within normal limits and indicates a therapeutic effect. Question 19. The nurse is caring for a client who was recently prescribed antihypertensive medications. Which statement, if made by the client, requires follow-up? Here are the options. Option A. My pulse decreases after taking my metoprolol. Option B. I started taking my furosemide right before I went to sleep. Option C. I am seasoning my foods without salt while on lisinopril. Option D. I wear my clonidine patch for 7 days. The correct answer is option B. I started taking my furosemide right before I went to sleep. Correct answer. I started taking my furosemide right before I went to sleep. Furosemide is a loop diuretic that should be dosed early in the day. This prevents the client from experiencing nocturia. This also reduces the risk of falls by the client, as they will not have to wake up at night when there is reduced lighting. Question 20. The nurse is caring for a client who has just been diagnosed with peritonitis. Which of the following medications should the nurse anticipate the primary health care provider PHCP will prescribe? Here are the options. Option A. Pantoprazole. Option B. Ciprofloxacin. Option C. Lactulose. Option D. Loperamide. The correct answer is option B. Ciprofloxacin. Correct answer, ciprofloxacin. Peritonitis is an intra-abdominal severe infection that has a significant mortality rate. Peritonitis may originate from perforation appendix, intestine, etc., which causes a significant amount of fluid and bacteria to shift into the peritoneum. The priority treatment in peritonitis is administering prescribed antibiotics such as ciprofloxacin, metronidazole, or ceftriaxone. Question 21. The nurse is caring for a client with human immunodeficiency virus HIV. It would be appropriate for the nurse to assign the client to a room with the client diagnosed with. Here are the options. Option A, infectious mononucleosis. Option B, mycoplasma pneumonia. Option C, gastroenteritis rotavirus. Option D, mumps infectious parasitis. The correct answer is option A, infectious mononucleosis. Correct answer, infectious mononucleosis. Infectious mononucleosis IM requires standard precautions. Disease transmission is spread by prolonged exposure to human saliva and is difficult to spread. Often IM is referred to as the kissing disease because prolonged kissing may transmit this pathogen. It is appropriate to place a client with HIV in the same room as a client with IM. HIV requires standard precautions. Question 22. The nurse is taking the vital signs of a client with a diagnosis of acute lymphoblastic leukemia all. His temperature is 38.7 degrees C. What is the nurse's priority? Here are the options. Option A. Place cool washcloths on the client's head. Option B. Continue with the assessment. Option C. Obtain intravenous access on the client. Option D. Assess the client's perfusion. The correct answer is option C. Obtain intravenous access on the client. Correct answer. Obtain intravenous access on the client. It is the priority action to establish intravenous access to this client. This client has a diagnosis of acute lymphoblastic leukemia all, so the nurse knows that the client is immunocompromised. The client is very susceptible to infections, and with a fever of 38.7 degrees C, there should be a high index of suspicion for disease. Broad-spectrum Roman 4 antibiotics will need to be started right away. Therefore, it is the priority for the nurse to start an Roman 4. Question 23. Which statement from the 13-year-old girl with acute lymphoblastic leukemia all shows the LPN that she comprehends the side effects of steroid medications? Select all that apply. Choices. Steroids will help me grow taller and stronger. I can stop taking my steroids once I start feeling better. Steroids will help cure my leukemia. Steroids will make me gain weight, but I can easily lose it. Here are the options. Option A. Steroids can weaken my immune system and increase my risk of infections. The correct answer is option A. Steroids can weaken my immune system and increase my risk of infections. Correct answer. Steroids can weaken my immune system and increase my risk of infections. Steroids can weaken my immune system and increase my risk of infections. This statement demonstrates comprehension of a common side effect of steroid medications in suppressing the immune system, increasing susceptibility to infections. Question 24. The licensed practical/vocational nurse LPN/VN is working with a registered nurse caring for a child experiencing an adrenal crisis. The RN has established a peripheral vascular access device, and the LPN/VN anticipates the RN to administer intravenous. Select all that apply. Choices: potassium chloride, hydrocortisone, desmopressin, 5% dextrose with 0.9% saline. Here are the options. Option A. 5% dextrose with 0.9% saline hydrocortisone. The correct answer is option A. 5% dextrose with 0.9% saline hydrocortisone. Correct answer. 5% dextrose with 0.9% saline hydrocortisone. An adrenal crisis is a medical emergency for both an adult and a child. Remember, you need the treatment in an adrenal crisis, Addisonian crisis. The immediate treatment for a client in an adrenal crisis is replacing the corticosteroid via intravenous Roman-4 hydrocortisone. The treatment goal of administering Roman-4 hydrocortisone is to increase the low glucose levels and retain some of the fluid and sodium. The second essential treatment is administering Roman-4 fluids of 5% dextrose with 0.9% saline. The 5% dextrose with 0.9% saline will raise the glucose D5 and circulating volume 0.9% saline. Giving D5W alone would be detrimental as the water will lower serum sodium levels. Question 25. Which of the following client conditions are examples of subjective data? Select all that apply. Choices. The client reports feeling nauseated. The client's feet are swollen. The client tells the nurse she is nervous about test results. The client reports an itchy rash on his leg. The client rates her pain as a 6 on a scale of 1 to 10. Here are the options. Option A. The client reports feeling nauseated. The client tells the nurse she is nervous about test results. The client reports an itchy rash on his leg. The correct answer is option A. The client reports feeling nauseated. The client tells the nurse she is nervous about test results. The client reports an itchy rash on his leg. Correct answer. The client reports feeling nauseated. The client tells the nurse she is nervous about test results. The client reports an itchy rash on his leg. Question 26. The nurse is assessing a client who just returned from surgery. The nurse checks preoperative vital signs at 8:30 a.m. to compare them with the current vital signs at 10:30 a.m. What action should the nurse take? See the exhibit. Here are the options. Option A. Assess the surgical wound. Option B. Collect blood cultures. Option C. Administer oxygen at 2L/minute. Option D. Encourage by mouth PO fluids. The correct answer is option A. Assess the surgical wound. Correct answer. Assess the surgical wound. The client's 10:30 a.m. vital signs show signs of shock. Considering this client is in the immediate post-operative period, the nurse should assess the surgical wound for signs of hemorrhage. The nurse should reinforce the dressing if this is the source of the bleeding. The nurse should notify the primary healthcare physician (PHCP) of the client's change in condition. Question 27. The licensed practical/vocational nurse LPN/VN reviews newly prescribed medications for a client taking prescribed lithium. Which medication requires further follow-up by the LPN/VN? Here are the options. Option of venlafaxine. Option B hydrochlorothiazide. Option C gabapentin. Option D losartan. The correct answer is option B, hydrochlorothiazide. Correct answer, hydrochlorothiazide. A client taking lithium should be instructed to avoid dehydration and hyponatremia. Lithium is a salt. When the client has decreased fluid volume, the drug accumulates and raises the lithium level. HCTZ is a thiazide diuretic and is contraindicated for a client taking lithium because of its ability to decrease fluid and sodium levels. Question 28. See the image below. Here are the options. Option A. Metoprolol 50 mg PO daily. Option B. Lisinopril 40 mg PO daily. Option C. Albuterol 2.5 mg via nebulizer daily. Option D. Diltiazem XR 120 mg PO daily. The correct answer is option C. Albuterol 2.5 mg via nebulizer daily. Correct answer. Albuterol 2.5 mg via nebulizer daily. The nurse is caring for a client with the following clinical data. Which medication would the nurse clarify with the primary healthcare provider PHCP before administration based on the vital signs? The vital signs versus are all within normal limits except the pulse, which is 123 bpm, and the blood pressure is slightly elevated. This should cause the nurse to clarify the prescription of albuterol with the PHCP as this medication increases heart rate. This would foreseeably worsen the tachycardia that the client is already experiencing. Question 29. NGN the nurse is performing data collection of a newborn immediately following birth. Click to highlight the findings in the nursing assessment that require follow-up choices. Click to highlight the findings in the nursing assessment that require follow-up. Neck apical pulse 68 breaths per minute, vigorous axillary temperature. Here are the options. Option A. Respiratory rate 68 breaths per minute, apical pulse. The correct answer is option A. Respiratory rate 68 breaths per minute, apical pulse. Correct answer. Respiratory rate 68 breaths per minute, apical pulse. Clear lung fields. These compensatory mechanisms may fail if the rewarming measures are not promptly implemented. Question 30. The nurse is teaching a client newly diagnosed with osteoporosis. The nurse should recommend that the client perform which type of exercise? Here are the options. Option A. Stretching. Option B. Stability and balance. Option C. Cardiovascular. Option D. Weight bearing. The correct answer is option D. Weight bearing. Correct answer, weight bearing. Low-impact weight-bearing exercises are recommended for a client with osteoporosis because of their ability to increase bone density. Examples of this type of exercise include walking and elliptical training. Question 31. Which steps should the LPN reinforce with the patient regarding blood glucose monitoring at home? Select all that apply. Choices: washing and drying hands before testing. Choosing a different puncture site for each test. Read the monitor's instructions as each monitor may have different requirements. Recording the glucose level and the date/time of the test. Here are the options. Option A. Washing and drying hands before testing. Choosing a different puncture site for each test. Read the monitor's instructions as each monitor may have different requirements. The correct answer is option A. Washing and drying hands before testing. Choosing a different puncture site for each test. Read the monitor's instructions as each monitor may have different requirements. Correct answer: washing and drying hands before testing. Choosing a different puncture site for each test. Read the monitor's instructions as each monitor may have different requirements. Read the monitor's instructions as each monitor may have different requirements. It's always essential to follow the instructions provided by the manufacturer of your specific glucose meter and test strips, as they may have specific guidelines on whether or not to wipe away the first drop of blood. Question 32. The nurse has collected a client's vital signs. The nurse notes that the client's apical pulse was 75 beats per minute and the radial pulse was 69 beats per minute. The nurse should document this finding as. Here are the options. Option A, widened pulse pressure. Option B, a pulse deficit. Option C, pulsus paradoxus. Option D, an expected finding. The correct answer is option B, A pulse deficit. Correct answer. A pulse deficit. A pulse deficit is a difference between the apical and peripheral pulses. This finding may signal that the client has a dysrhythmia, and the nurse should consider obtaining a 12-lead electrocardiogram and or continuous telemetry monitoring. Question 33. The nurse on the medical surgical floor is preparing to receive a newly admitted client who reports an allergy to latex. The nurse should plan to take which action? Select all that apply. Choices. Verify the allergy is documented in the medical record. Use disposable equipment during client care. Assign the client to a private room. Post a sign in the client's room noting the allergy. Communicate the allergy to the dietary department. Here are the options. Option A. Verify the allergy is documented in the medical record. Post a sign in the client's room noting the allergy. Communicate the allergy to the dietary department. The correct answer is option A. Verify the allergy is documented in the medical record. Post a sign in the client's room noting the allergy. Communicate the allergy to the dietary department. Correct answer. Verify the allergy is documented in the medical record. Post a sign in the client's room noting the allergy. Communicate the allergy to the dietary department. Question 34. The nurse is setting up the room for a patient newly diagnosed with celiac disease. She knows to place the patient on which of the following precautions? Here are the options. Option A. Droplet precautions. Option B. Contact precautions. Option C. Standard precautions. Option D. Neutropenic precautions. The correct answer is option B. Contact precautions. Correct answer. Contact precautions. Celiac disease requires standard precautions. It is not an infectious disease and is not transmitted from person to person. Therefore, there is no reason to initiate any additional precautions. Question 35. A nurse is reviewing prescriptions for assigned clients. Which prescriptions require follow-up with the primary healthcare provider? A client with select all that apply. Choices. Congestive heart failure prescribed diltiazem. Hypertension prescribed clonidine. Diabetes insipidus prescribed hydrocortisone. Pulmonary embolia prescribed clopidogrel. Here are the options. Option A. Congestive heart failure prescribed diltiazem. Diabetes insipidus prescribed hydrocortisone. Pulmonary embolia prescribed clopidogrel. The correct answer is option A. Congestive heart failure prescribed diltiazem. Diabetes insipidus prescribed hydrocortisone. Pulmonary embolia prescribed clopidogrel. Correct answer. Congestive heart failure prescribed diltiazem. Diabetes insipidus prescribed hydrocortisone. Pulmonary embolia prescribed clopidogrel. Question 36. The nurse is discussing a breach of the standard of care with a nursing student. The nurse uses which of the following situations as an example of negligence? Here are the options. Option A. The UAP unlicensed assistive personnel fills a water basin with warm water while the client with depression combs her hair. Option B. A nurse transcribes a new medication order. Questran powder 2 Oz bid with wet food or 1 full glass of water. Option C. The nurse checks the distal pulses of a client's legs 2 hours after they have returned from a cardiac catheterization. Option D. The nurse observes a UAP enter the room of a client on contact precautions wearing gloves and a gown. The correct answer is option C. The nurse checks the distal pulses of a client's legs 2 hours after they have returned from a cardiac catheterization. Correct answer. The nurse checks the distal pulses of a client's legs 2 hours after they have returned from a cardiac catheterization. Delaying the assessment of distal pulses for 2 hours after a cardiac catheterization is a breach of the standard of care. Prompt and frequent assessments are crucial to monitor for potential complications and ensure the client's safety. Question 37. NGN *. The nurse cares for a 41-year-old female in the emergency department. ED item 2 of 6 choices. Pain in the affected extremity, swelling to the affected area, intact sensation. Here are the options. Option A. Compartment syndrome, cellulitis and venous thromboembolism. Cellulitis and venous thromboembolism. The correct answer is option A. Compartment syndrome, cellulitis, and venous thromboembolism. Cellulitis and venous thromboembolism. Correct answer: compartment syndrome, cellulitis, and venous thromboembolism. Cellulitis and venous thromboembolism. Question 38. The nurse cares for a 41-year-old female in the emergency department. ED item 3 of 6 choices. Complete the sentences below from the list of options the client is at greatest risk for. The primary healthcare provider (PHCP) will likely order a to confirm this diagnosis. Here are the options. Option A. Venous thromboembolism, venous duplex ultrasonography. The correct answer is option A. Venous thromboembolism, venous duplex ultrasonography. Correct answer: venous thromboembolism, venous duplex ultrasonography. This client most likely has venous thromboembolism. The triggering event of the VTE was likely the injury to her leg. Combined with the oral contraceptives and her tobacco use, these are substantial risk factors for her developing VTE. Question 39. The nurse cares for a 41-year-old female in the emergency department. ED item 4 of 6 choices. Clopidogrel-venous duplex ultrasonography. Proximal deep vein thrombosis in the left popliteal vein. Here are the options. Option A. Not anticipated. The correct answer is option A. Not anticipated. Correct answer: not anticipated. Venous duplex ultrasonography. Proximal deep vein thrombosis in the left popliteal vein. Question 40. The nurse cares for a 41-year-old female in the emergency department. ED item 5 of 6 choices. Activity as tolerated: oxycodone 5 mg POQ 6 hours, PRN pain warfarin 2 mg PO. Daily admit to med/surg. Here are the options. Option A. PTT, weight, platelet count. The correct answer is option A. A PTT, weight, platelet count. Correct answer: a PTT, weight, platelet count. Admit to med/surg. Question 41. The nurse cares for a 41-year-old female in the emergency department. ED item 6 of 6. Here are the options. Option A. 110 seconds. The correct answer is option A. 110 seconds. Correct answer: 110 seconds. While a client receives a heparin infusion, the goal is to prolong the control baseline of PTT 1.5 to 2.5 times. 110 seconds is too prolonged and requires the nurse to review the heparin protocol to hold the infusion for a specified period or reduce the rate. The other labs are within normal limits. The client was prescribed warfarin, whose INR is now 2.7, which is therapeutic as the goal is to have the INR between 2-3. Question 42. The nurse knows that which of the following scenarios are common reasons for disciplinary action against practical nurses by the State Board of Nursing? Select all that apply. Choices: failure to administer medications as prescribed, violation of client confidentiality, poor attendance record, engaging in personal relationships with clients. Here are the options. Option A: failure to administer medications as prescribed, violation of client confidentiality, engaging in personal relationships with clients. The correct answer is option A: failure to administer medications as prescribed, violation of client confidentiality, engaging in personal relationships with clients. Correct answer: failure to administer medications as prescribed, violation of client confidentiality, engaging in personal relationships with clients. Question 43. When instructing an ambulatory, alert, and oriented female client, what instructions should the nurse provide regarding collecting a midstream urine specimen? Here are the options. Option A: cleanse the perineal area from back to front with circular wipes. Option B: cleanse the vaginal meatus from the front to back. Option C: use a new antiseptic wipe with each wipe and wipe from the inner labia to the outer labia. Option D: use one wipe to cleanse the inner labia and another for the outer labia. The correct answer is option C. Use a new antiseptic wipe with each wipe and wipe from the inner labia to the outer labia. Correct answer: use a new antiseptic wipe with each wipe and wipe from the inner labia to the outer labia. Use a new antiseptic wipe with each wipe and wipe from the inner labia to the outer labia. Question 44. This nurse is caring for a client who is receiving prescribed sitagliptin. The nurse understands that this medication is intended to treat which condition? Here are the options. Option A: hyperlipidemia. Option B: diabetes mellitus. Option C: hypothyroidism. Option D: hypertension. The correct answer is option B: diabetes mellitus. Correct answer: diabetes mellitus. Sitagliptin is a DPP-4 inhibitor used in managing diabetes mellitus type Roman II. This medication reduces blood glucose levels by delaying gastric emptying and slowing the rate of nutrient absorption into the blood. Question 45. A primigravida client begins labor and is visibly upset that her family is unavailable. Which is the most appropriate approach for the nurse to take to help meet the client's needs at this time? Here are the options. Option A: assure her that the nursing triage team will stay with her at all times. Option B: encourage the client regarding her own abilities to cope and maintain a sense of control. Option C: ask the client if there is someone else who wants to be her support person. Option D: tell the client she will try to locate her family. The correct answer is option C. Ask the client if there is someone else who wants to be her support person. Correct answer: ask the client if there is someone else who wants to be her support person. Allow the client to select another individual to give support. This allows her to have someone with her until her family can be with her. Women and families have different expectations during childbearing. These expectations are shaped by their experiences, knowledge, belief systems, social and family backgrounds. In most cases, a childbirth companion or social support during birth has improved the whole birth experience. Question 46. The nurse is caring for a client who is receiving prescribed pregabalin. The client is experiencing the intended effect when they report less. Here are the options. Option A, neuropathic pain. Option B, cravings for cigarettes. Option C, binge eating. Option D, depressive symptoms. The correct answer is option A, neuropathic pain. Correct answer, neuropathic pain. Pregabalin is indicated in treating neuropathic pain, certain anxiety disorders, and focal seizures. This controlled substance is 5 times more potent compared to gabapentin. Question 47. The nurse is collecting data on a child admitted with varicella-zoster chickenpox. Which of the following assessment findings would be expected? Here are the options. Option A, linear cracks in the epidermis that extend into the dermis. Option B, painful blisters filled with clear fluid. Option C, nodules filled with either liquid or semi-solid material. Option D, elevated plateau-like patches. The correct answer is option B, painful blisters filled with clear fluid. Correct answer, painful blisters filled with clear fluid. Varicella-zoster chickenpox virus (VZV) is a condition that causes the individual to experience low-grade fever, malaise, and anorexia. Characteristically, the client with VZV develops a papule type of rash that transitions into. Once these vesicles rupture, it causes shallow erosions that start to heal. These vesicles are commonly painful and cause the client intense itching. Question 48. The nurse is reviewing a plan of care for a client who has a HaloVest immobilizer halo brace following a cervical spine fracture. Which of the following should the nurse expect to be in the client's plan of care? Select all that apply. Choices. Pin care every shift, placing the wrench on the device. Use straws when providing liquids, neck flexion and extension exercises. Here are the options. Option A, pin care every shift, placing the wrench on the device. Report loosening of the pins. The correct answer is option A, pin care every shift, placing the wrench on the device. Report loosening of the pins. Correct answer, pin care every shift, placing the wrench on the device. Report loosening of the pins. Neck flexion and extension exercises. Question 49. *NGN*. The home health nurse visits a client with chronic diabetes insipidus. Item 1 of 1. Here are the options. Option A, I will need to weigh myself at the same time every day. I need to keep a log of my fluid intake and urine output. I may need an additional dose if I keep urinating a lot. The correct answer is option A. I will need to weigh myself at the same time every day. I need to keep a log of my fluid intake and urine output. I may need an additional dose if I keep urinating a lot. Correct answer. I will need to weigh myself at the same time every day. I need to keep a log of my fluid intake and urine output. I may need an additional dose if I keep urinating a lot. I need to keep a log of my fluid intake and urine output. Question 50. The infection control nurse is responding to an outbreak of norovirus in the facility. The nurse should recommend that. Here are the options. Option A, staff wears a surgical mask when providing client care. Option B, disposable utensils and dishware are used for meals. Option C, dietary staff wears a face shield when preparing client meals. Option D, commonly touched surfaces be disinfected with a bleach solution. The correct answer is option D. Commonly touched surfaces be disinfected with a bleach solution. Correct answer, commonly touched surfaces be disinfected with a bleach solution. Norovirus is a virus that is commonly implicated in gastroenteritis. The transmission of norovirus primarily occurs through surfaces contaminated with norovirus and then touching the mouth or other food items. Further, norovirus may be transmitted by having direct contact with another person who is infected or eating food or drinking liquids that are contaminated with norovirus. It is also recommended that hand hygiene be performed with soap and water as it is superior to alcohol-based hand rubs. Norovirus requires for a minimum of 48 hours after the symptoms resolve. Question 51. The licensed practical/vocational nurse LPN/VN is assisting in caring for a client who had bariatric surgery. Which of the following should be included? Here are the options. Option A. Pneumatic compression devices. Option B. Insertion of an indwelling urinary catheter. Option C. Strict bed rest. The correct answer is option A. Pneumatic compression devices. Correct answer, pneumatic compression devices. Following bariatric surgery, the client faces an array of complications including hemorrhage, wound disruption, pneumonia, and wound infection. Venous thromboembolism is a significant complication and may be mitigated using pneumatic compression devices and chemical prophylaxis. Question 52. Following bariatric surgery, which of the following should the nurse give priority to preventing? Here are the options. Option A. Pain. Option B. Depression. Option C. Thrombophlebitis. Option D. Wound infection. The correct answer is option D. Wound infection. Correct answer, wound infection. Wound infection is the most common complication among obese clients who have had surgery. This is mostly in part due to inadequate blood supply in the adipose tissue of obese clients. Question 53. Which of the following are important nursing interventions for client before going down for a cardiac catheterization? Select all that apply. Choices. Verify if they have any allergies. Check their BUN and creatinine levels. Check their CBC for WBC level. Administer acetaminophen. Here are the options. Option A. Verify if they have any allergies. Check their BUN and creatinine levels. The correct answer is option A. Verify if they have any allergies. Check their BUN and creatinine levels. Correct answer, verify if they have any allergies. Check their BUN and creatinine levels. It is essential to verify if a client has any allergies before any procedure. We must know if there are medications that are unsafe to administer to this client. We are explicitly verifying that the client is not allergic to iodine or shellfish. This is important because an iodine-based dye is used during cardiac catheterization to visualize the vessels. Should you discover that the client is allergic to iodine or shellfish, contact the healthcare provider immediately and do not administer the dye. Question 54. The patient with COP reports to the nurse that she has trouble sleeping at night. Which question is most important for the nurse to ask next? Here are the options. Option A. What do you eat before you go to bed? Option B. How many pillows do you sleep on at night? Option C. Have you always been a light sleeper? Option D. Is your partner snoring and keeping you awake? The correct answer is option B. How many pillows do you sleep on at night? Correct answer. How many pillows do you sleep on at night? Orthopnea is shortness of breath that occurs when lying flat, causing the person to have to sleep propped up in bed or sitting in a chair. Asking the patient how many pillows she uses to sleep on is a way to assess if the patient has been educated about preventing orthopnea. COPD causes blocked or narrowed airways that make breathing more difficult. Patients may experience symptoms like wheezing, coughing, mucus production, and tightness in the chest. Smoking or exposure to harmful chemicals can cause COPD. Orthopnea is a common symptom of COPD patients. Question 55. A client presents to the emergency department ED with a suspected ectopic pregnancy. The nurse anticipates which diagnostic test will confirm this finding. Here are the options. Option A, non-stress testing. Option B, abdominal radiograph X-ray. Option C, transvaginal ultrasound. Option D, Doppler transducer. The correct answer is option C, transvaginal ultrasound. Correct answer, transvaginal ultrasound. An ectopic pregnancy EP is a medical emergency. The imaging of choice is a transvaginal ultrasound, as this type of ultrasound may visualize an extrauterine gestational sac with a yolk sac or embryo with or without a heartbeat. Question 56. The nurse is caring for a client with an ectopic pregnancy. Which findings does the nurse expect? Select all that apply. Choices: pelvic pain, vaginal bleeding, positive pregnancy test, dysuria, fever. Here are the options. Option A, pelvic pain, vaginal bleeding, positive pregnancy test. The correct answer is option A, pelvic pain, vaginal bleeding, positive pregnancy test. Correct answer, pelvic pain, vaginal bleeding, positive pregnancy test. Unilateral abdominal pain that may be confined to the pelvic area. Question 57. The nurse is preparing to measure the fundal height of a client at 16 gestational weeks. The nurse should prepare the client for this assessment by instructing the client to. Here are the options. Option A, lay in a side-lying position with the knees bent. Option B, prepare for the insertion of an intravenous Roman IV catheter. Option C, not to eat or drink 2 hours after this assessment. Option D, empty their bladder. The correct answer is option D, empty their bladder. Correct answer, empty their bladder. Measuring the fundal height is a painless and non-invasive way to evaluate fetal growth patterns and confirm gestational age. For this assessment, the client should empty their bladder to prevent elevation of the uterus. Question 58. The nurse is assisting a client with diverticulosis to select appropriate foods. Which foods should be avoided? Select all that apply. Choices: bran fresh peaches, cucumber salad, cooked broccoli, cabbages. Here are the options. Option A, cucumber salad, cooked broccoli, cabbages. The correct answer is option A, cucumber salad, cooked broccoli, cabbages. Correct answer, cucumber salad, cooked broccoli, cabbages. Cabbages. Question 59. The nurse is caring for a client who is postoperative ordered incentive spirometry. The nurse understands that this device will help prevent which complication? Choices: venous thromboembolism, hypostatic pneumonia, aspiration pneumonia, obstructive sleep apnea. Here are the options. Option A, hypostatic pneumonia. The correct answer is option A, hypostatic pneumonia. Correct answer, hypostatic pneumonia. Hypostatic pneumonia after surgery is best prevented through incentive spirometry and early mobilization. The purpose of incentive spirometry is to promote deep breathing to prevent or treat atalitoses in the postoperative client. Hypostatic pneumonia is caused by pulmonary congestion in the dorsal region of the lungs. This type of pneumonia is common for those who are bedridden or have restricted mobility. Hypostatic pneumonia can be prevented through early postoperative ambulation and incentive spirometry. Question 60. The practical nurse cares for a patient with hypokalemia and accelerated hypertension. The physician has listed the cause as hyperaldosteronism. Which of the following endocrine disorders causes increased aldosterone? Select all that apply. Choices: Cushing's disease, Conn's syndrome, Crohn's disease, Addison's disease. Here are the options. Option A: Cushing's disease, Conn's syndrome. The correct answer is option A: Cushing's disease, Conn's syndrome. Correct answer: Cushing's disease, Conn's syndrome. Cushing's disease results from increased secretion of adrenocorticotropic hormone X by the pituitary gland, which stimulates the adrenal cortex, leading to elevated cortisol and aldosterone levels. Symptoms include abdominal obesity, moon phases, neck hump, abdominal stria, high blood glucose, secondary diabetes, hypertension, hypokalemia, osteoporosis, and increased risk of infections. Question 61. The nurse is assessing a client with pheochromocytoma. Which of the following would be an expected finding? Select all that apply. Choices: hyperglycemia, hypertension, ataxia, oliguria, headache. Here are the options. Option A: hyperglycemia, hypertension, headache. The correct answer is option A: hyperglycemia, hypertension, headache. Correct answer: hyperglycemia, hypertension, headache. Headache. Question 62. The licensed practical/vocational nurse LPN/VN is collecting data on a client who is pregnant. Which of the following findings would require follow-up? Select all that apply. Choices: third S3 heart sound, absence of menstruation, burning with urination, breast tenderness, dependent edema. Here are the options. Option A: burning with urination, decrease appetite. The correct answer is option A: burning with urination, decrease appetite. Correct answer: burning with urination, decrease appetite. Urinary frequency and urgency are common during pregnancy because of hormonal changes, increased blood flow to the kidneys, blood volume, and glomerular filtration rate (GFR). Noxuria is also common because sodium and water are retained during the day and excreted overnight. Burning with urination is expected and may require prescribed urine analysis UA to rule out cystitis. A decrease in appetite is also expected, as an increase in appetite is common because the caloric requirements of pregnancy significantly increase. The nurse should inquire if the client is experiencing excessive nausea, inhibiting her appetite. Question 63. The nurse is demonstrating the appropriate use of a car seat to a client. The nurse is demonstrating which level of prevention? Here are the options. Option A: primary. Option B: secondary. Option C: tertiary. Option D: quaternary. The correct answer is option A: primary. Correct answer: primary. Secondary: early identification of the disease, screenings. Health fairs. Question 64. The nurse is evaluating her client's lab results and notes that the potassium is 5.5 mx/L 3.5-5 mx/L. Which of the following AKD changes would be associated with hyperkalemia in a client? Select all that apply. Choices: inverted T waves tall, peaked T waves prolonged PR interval widened QRS interval. Here are the options. Option A: widened QRS interval, tall, peaked T waves, prolonged PR interval. The correct answer is option A: widened QRS interval, tall, peaked T waves, prolonged PR interval. Correct answer: widened QRS interval, tall, peaked T waves, prolonged PR interval. Widened QRS interval. Question 65. The nurse is caring for a client who is prescribed lamotrigine. The nurse understands that this medication is intended to treat. Here are the options. Option A: acute spinal shock. Option B: epilepsy. Option C: Parkinson's disease. Option D: multiple sclerosis. The correct answer is option B: epilepsy. Correct answer: epilepsy. Lamotrigine is approved to treat epilepsy to prevent seizures. This medication is also indicated in maintaining bipolar disorder to provide mood stabilization. Lamotrigine is safe during pregnancy, which makes this medication quite attractive for a client with bipolar disorder and epilepsy who wants to consider family planning. Question 66. The nurse is assessing a client with appendicitis. Which of the following would be an expected finding? Select all that apply. Choices: leukocytosis, melena fever, nausea, and vomiting, anorexia. Here are the options. Option A: leukocytosis, fever, nausea, and vomiting. The correct answer is option A: leukocytosis, fever, nausea, and vomiting. Correct answer: leukocytosis, fever, nausea, and vomiting. Clinical manifestations of appendicitis include leukocytosis, fever, nausea and vomiting, right lower quadrant pain, and anorexia. Question 67. The nurse is caring for a client receiving buspirone. Which of the following client statements would indicate a therapeutic response? Here are the options. Option A: I am less depressed and able to spend time with my friends. Option B: my anxiety has lessened and I have started going out more. Option C: I noticed an improvement in my concentration. Option D: I have been able to fall asleep without any problem. The correct answer is option B: my anxiety has lessened and I have started going out more. Correct answer: my anxiety has lessened and I have started going out more. Buspirone is a serotonergic medication indicated for individuals with. The client reporting decreased anxiety would indicate a therapeutic effect. Question 68. The home health nurse is assessing a client with suspected carbon monoxide poisoning. The nurse should take which priority action? Here are the options. Option A: move the client outdoors. Option B: notify the primary healthcare provider PHCP. Option C: auscultate the client's lung sounds. Option D: assess the client's pulse oximetry. The correct answer is option A: move the client outdoors. Correct answer: move the client outdoors. Carbon monoxide poisoning is a serious emergency that is often fatal if not promptly treated. This requires the client to be immediately relocated away from the carbon monoxide. Moving the client outside is effective because of the fresh air. Once this has been completed, the nurse should notify the PHEP or call Emergency Medical Services (EMS) for further treatment. Another priority treatment is providing the client with 100% high-flow oxygen regardless of their pulse oximetry, lung sounds, or arterial blood gas results. Question 69. The nurse is preparing a prenatal class focused on nutrition. Which of the following statements should the nurse reinforce? Here are the options. Option A. Raw sushi is okay to consume during pregnancy because of its high protein level. Option B. Caffeine intake should be limited during pregnancy to less than 200 mg/day. Option C. To increase your iron intake, choose citrus fruits or strawberries. Option D. Sodium intake is restricted to 1 gram per day during all 3 trimesters. The correct answer is option B. Caffeine intake should be limited during pregnancy to less than 200 mg/day. Correct answer. Caffeine intake should be limited during pregnancy to less than 200 mg/day. Caffeine intake should be less than 200 mg/day. Excessive caffeine intake has been linked to miscarriage or preterm birth. An ATA's 240 ml cup of brewed coffee contains approximately 137 mg of caffeine. Question 70. You are reinforcing counseling for 2 parents who are preparing for the birth of their first child. The father has sickle cell anemia and the mother is a carrier. You tell them that their baby has what chance of having sickle cell anemia? Here are the options. Option A. 25%. Option B. 50%. Option C. 75%. Option D. 100%. The correct answer is option B. 50%. Correct answer, 50%. Their baby has a 50% chance of having sickle cell anemia. The father is SS because he has the disease, and the mother is SS since she is a carrier. Question 71. The nurse is reinforcing education to parents of a child with sickle cell anemia. Which of the following instructions should be reinforced? Select all that apply. Choices. Increase the amount of fluids throughout the day. Perform vigorous exercise for 60 minutes a day. Avoid areas with high altitudes. Notify the primary healthcare provider PHCP for any illnesses. Here are the options. Option A. Increase the amount of fluids throughout the day. Avoid areas with high altitudes. Notify the primary healthcare provider PHCP for any illnesses. The correct answer is option A. Increase the amount of fluids throughout the day. Avoid areas with high altitudes. Notify the primary healthcare provider PHCP for any illnesses. Correct answer. Increase the amount of fluids throughout the day. Avoid areas with high altitudes. Notify the primary healthcare provider PHCP for any illnesses. Since infection risk is higher in those with sickle cell anemia, the nurse should reinforce the child washing their hands frequently. Question 72. The nurse is teaching a group of students about drug toxicity. The nurse is correct in stating which of the following. Select all that apply. Choices. Naloxone is the treatment for opioid toxicity. Magnesium is the treatment for lead toxicity. N-acetylcysteine is the treatment for naproxen toxicity. Calcium is the treatment for magnesium toxicity. Here are the options. Option A. Naloxone is the treatment for opioid toxicity. Calcium is the treatment for magnesium toxicity. Flumazenil is the treatment for benzodiazepine toxicity. The correct answer is option A. Naloxone is the treatment for opioid toxicity. Calcium is the treatment for magnesium toxicity. Flumazenil is the treatment for benzodiazepine toxicity. Correct answer. Naloxone is the treatment for opioid toxicity. Calcium is the treatment for magnesium toxicity. Flumazenil is the treatment for benzodiazepine toxicity. Question 73. You're providing education to a group of parents about toilet training for their toddler-aged children. Which of the following educational points should you include? Select all that apply. Choices. Most children are ready to begin toilet training between 12 and 18 months old. Stay with the child while they are trying to use the toilet. Limit sitting on the toilet to 5-8 minutes at a time. A child should be able to stay dry throughout the night before you begin toilet training. Here are the options. Option A. Stay with the child while they are trying to use the toilet. Limit sitting on the toilet to 5-8 minutes at a time. The correct answer is option A. Stay with the child while they are trying to use the toilet. Limit sitting on the toilet to 5-8 minutes at a time. Correct answer. Stay with the child while they are trying to use the toilet. Limit sitting on the toilet to 5-8 minutes at a time. Question 74. A 4-year-old boy is recovering from abdominal surgery at the pediatric unit. As the nurse caring for the child, which of the following activities do you recommend that he prioritize? Here are the options. Option A. Blowing bubbles. Option B. Peekaboo. Option C. Building blocks. Option D. Playing with clay. The correct answer is option A. Blowing bubbles. Correct answer. Blowing bubbles. Letting the child blow bubbles will stimulate lung expansion, preventing respiratory problems arising from surgery. Following the abdominal surgery, respirations are not as efficient because anesthesia hampers it, and it hurts to breathe. Consequently, mucus builds up, and the lung may collapse fully or partially atelectasis. Pneumonia may follow. The collapsed lung may result in dyspnea and respiratory failure and complicate the post-operative recovery. Therefore, primary health care providers PHCP order incentive spirometers to reduce the risk of respiratory problems after surgery. However, if the child is under the age of 5 or is unable to use the incentive spirometer for another reason, they should blow bubbles for 2 to 3 minutes every hour. Blowing bubbles will serve as an alternative to incentive spirometry in these children. Question 75. The nurse is assessing a 2-year-old with the following symptoms: excessive drooling, stridor, difficulty swallowing, and difficulty speaking. Which of the following conditions does the nurse suspect? Here are the options. Option A. Croup. Option B. Epiglottitis. Option C. Laryngotracheal bronchitis. Option D. Bronchiolitis. The correct answer is option B. Epiglottitis. Correct answer. Epiglottitis dysphonia. Question 76. The nurse is reinforcing education to the parents of a toddler diagnosed with bronchiolitis. She tells them that which of the following is the most likely cause of bronchiolitis? Here are the options. Option A. Haemophilus influenzae type B. Option B. Adenovirus. Option C. Respiratory syncytial virus RSV. Option D. Rhinovirus. The correct answer is option C. Respiratory syncytial virus RSV. Correct answer. Respiratory syncytial virus RSV. Respiratory syncytial virus RSV is the most likely cause of bronchiolitis. It is a common virus in children that causes respiratory illness and is especially common in children less than 2 years old. Question 77. The nurse is caring for a client with. The nurse should anticipate a prescription for which of the following medications? Here are the options. Option A, dicyclomine. Option B, metoclopramide. Option C, valacyclovir. Option D, amoxicillin. The correct answer is option D, amoxicillin. Correct answer, amoxicillin, is an antispasmodic medication used to treat gastrointestinal spasms, which is common in individuals with irritable bowel syndrome. Is a medication that causes gastric emptying and is used for nausea and vomiting. Is an antiviral indicated for herpes infections. Question 78. NGN 72-year-old male presents to the emergency department. Item 1 of 6 choices. Feelings of loneliness, feelings of hopelessness. Here are the options. Option A, feelings of hopelessness, feelings of loneliness, loss of his wife 8 months ago. The correct answer is option A, feelings of hopelessness, feelings of loneliness, loss of his wife 8 months ago. Correct answer, feelings of hopelessness, feelings of loneliness, loss of his wife 8 months ago. Question 79. NGN 72-year-old male presents to the emergency department. Item 2 of 6 choices. Would you tell me more about your bedtime routine? Could you describe the severity and quality of your pain? Are you having any thoughts of harming yourself? Here are the options. Option A, are you having any thoughts of harming yourself? The correct answer is option A. Are you having any thoughts of harming yourself? Correct answer. Are you having any thoughts of harming yourself? It is essential that the nurse recognize the client's cues as a concern for suicide. It is appropriate for the nurse to ask the client directly if he is having any thoughts of harming himself. The nurse should not ask leading questions such as, "You are not thinking about harming yourself, are you?" This type of question discourages the client from being honest. Assessing the client's bedtime rituals, pain level, or history of obtaining mental health services does not address the core concern of the client's safety. Question 80. NGN 72-year-old male presents to the emergency department. Item 3 of 6 choices. The greatest concern for this client is evidenced by the client's complete the following sentence from the list of options. Here are the options. Option A, suicide, feelings of hopelessness. The correct answer is option A, suicide, feelings of hopelessness. Correct answer, suicide, feelings of hopelessness. Suicide is absolutely the primary concern for this client. Central to suicidality is a client feeling hopeless, and this was explicitly expressed by the client. The depressive disorder that the client is likely experiencing needs to be addressed, but is not life-threatening as the thoughts of suicide. Question 81. NGN 72-year-old male presents to the emergency department. Item 4 of 6 choices. The nurse updates the nursing note with an entry at 1,450 and receives orders from the primary healthcare provider PHCP regular diet, open letters and packages before giving them to the client. Here are the options. Option A, not appropriate, appropriate. The correct answer is option A. Not appropriate. Appropriate. Correct answer. Not appropriate. Appropriate. Question 82. NGN 72-year-old male presents to the emergency department item 5 of 6 choices. You may have more energy with the medication. The nurse prepares to administer the prescribed bupropion. Which two teaching points should the nurse reinforce? Here are the options. Option A. You may have more energy with the medication. Take this medication in the morning to prevent sleep problems. The correct answer is option A. You may have more energy with the medication. Take this medication in the morning to prevent sleep problems. Correct answer. You may have more energy with the medication. Take this medication in the morning to prevent sleep problems. Bupropion is an atypical antidepressant that modulates norepinephrine and dopamine. This medication is activating and does provide the client with increased energy, therefore decreasing their weight. Bupropion does not cause sexual side effects like other antidepressants. Considering that this medication is activating, it would be appropriate for the nurse to advise the client to take it in the morning and not in the evening to avoid worsening the insomnia. Laboratory work is not necessary while a client is taking bupropion, nor is maintaining a diet consistent in fluid and salt. This dietary recommendation is for lithium. Question 83. NGN 72-year-old male presents to the emergency department item 6 of 6. Here are the options. Option A. The client was alert and oriented. He described his mood as good and had a cheerful effect. He denied any suicidal ideations. The correct answer is option A. The client was alert and oriented. He described his mood as good and had a cheerful effect. He denied any suicidal ideations. Correct answer. The client was alert and oriented. He described his mood as good and had a cheerful effect. He denied any suicidal ideations. Question 84. The nurse has provided medication instruction to a patient who has been prescribed metformin. Which of the following statements, if made by the patient, would indicate a correct understanding of the teaching? Here are the options. Option A. This medication may cause me to have bloating or loose stools. Option B. I will need to check my blood glucose prior to taking this medication. Option C. If I eat fewer carbohydrates in a day, I should skip a dose. Option D. The goal of this medication is to increase my hemoglobin A1C. The correct answer is option A. This medication may cause me to have bloating or loose stools. Correct answer. This medication may cause me to have bloating or loose stools. The most common side effect associated with metformin is gastrointestinal upset. This side effect typically occurs at the start of the therapy and subsides over time. To minimize these effects, the patient should take this medication with meals. Question 85. The nurse is caring for a group of children on the medical surgical unit. The nurse should initially follow up on the child who. Here are the options. Option A is receiving treatment for Hirschsprung's disease and has a temperature of 101 degrees F 38.3 degrees C. Option B has an indwelling urinary catheter and reports burning at the insertion site. Option C has scant blood in their newly established ostomy pouch. Option D has friends writing words on their fiberglass cast with different colored markers. The correct answer is option A. Is receiving treatment for Hirschsprung's disease and has a temperature of 101 degrees F 38.3 degrees C. Correct answer is receiving treatment for Hirschsprung's disease and has a temperature of 101 degrees F 38.3 degrees C. A major complication of is the development of enterocolitis manifested by fever, abdominal distension, vomiting, and increased abdominal pain. Emergent intervention is necessary because the child may develop sepsis leading to septic shock. Question 86. The primary healthcare provider PHCP prescribes 250 ml of 0.9% saline to infuse over 75 minutes. How many ml per hour will be administered to the client? Choices. To solve this problem, the formula of volume/time hours will be used. 75 minutes/60 minutes equals 1.25 HRS. First, convert the minutes to hours. Here are the options. Option A, 200 ml/HR. The correct answer is option A, 200 ml/HR. Correct answer, 200 ml/HR. First, convert the minutes to hours. Question 87. The nurse is caring for a client 3 hours postoperative following a laparoscopic appendectomy. Which of the following client data indicates the client is ready for discharge home? Select all that apply. Choices. Positive gag reflex, hypoactive bowel sounds, blood pressure 90/60 mmHg, incisional pain 2 on a scale of 0 to 10. Here are the options. Option A, positive gag reflex, hypoactive bowel sounds, incisional pain 2 on a scale of 0 to 10. The correct answer is option A, positive gag reflex, hypoactive bowel sounds, incisional pain 2 on a scale of 0 to 10. Correct answer, positive gag reflex, hypoactive bowel sounds, incisional pain 2 on a scale of 0 to 10. Hypoactive bowel sounds, the client's urinary output is optimal. A client, during surgery, often receives fluids that are excreted postoperatively. Low urinary output is more likely to occur because of the anticholinergic effects of the anesthesia. It would be a concern if the client had low or no urinary output. Question 88. The nurse is caring for a client who is receiving prescribed ketorolac. Which of the following findings would indicate a therapeutic response? Select all that apply. Choices. Decreased pain, decreased temperature, increased urinary output, increased muscle coordination, decreased blood pressure. Here are the options. Option A, decreased pain, decreased temperature. The correct answer is option A, decreased pain, decreased temperature. Correct answer, decreased pain, decreased temperature. Decreased blood pressure. Question 89. Which of these would be the most appropriate way to document a client's refusal of medication? Here are the options. Option A. The client refused the heparin injection when I tried to administer it. She yelled at me, saying I do not want that injection right now, and told me to leave the room. I explained the risks of not taking the medication. She seemed very annoyed that I tried to give it at that time. I will attempt again later in my shift. Option B. Subcutaneous heparin injection was attempted to be given to the client per the physician's order. The client refused, stating, I do not want that injection. Potential risks for refusing the medication were reviewed with the client, and the client verbalized understanding. Option C. Client stated she did not want the SQ heparin injection at this time. The risks of not taking this med was reviewed with the client. Client verbalized understanding. Option D. Heparin refused during the shift. Risks reviewed. The correct answer is option B. Subcutaneous heparin injection was attempted to be given to the client per the physician's order. The client refused, stating, "I do not want that injection." Potential risks for refusing the medication were reviewed with the client, and the client verbalized understanding. Correct answer. Subcutaneous heparin injection was attempted to be given to the client per the physician's order. The client refused, stating, "I do not want that injection." Potential risks for refusing the medication were reviewed with the client, and the client verbalized understanding. Documentation in healthcare should be objective and thorough, but direct. It should be articulate, with correct grammar and spelling. The health record will be scrutinized by legal experts if a dispute about a client's care arises. In court, the health record is legal evidence of the care given to a client and is used to judge whether the interventions were timely and appropriate. Expert reviewers look for documentation of the client's baseline status, changes in status, interpretation of the changes, interventions implemented, and the client's responses to those interventions. The client has the right to refuse a medication regardless of her reasons and regardless of the consequences, except under certain circumstances, for example, incompetency. It is up to the nurse to document thoroughly and accurately any client's refusal. Question 90. The licensed practical/vocational nurse LPN/VN is collecting data on a client who just received 1 unit of packed red blood cells (PRBCS). Which of the following findings would indicate a therapeutic response? Here are the options. Option A. Banding peripheral pulses. Option B. Hematuria. Option C. Oral temperature 100.4 degrees F 38 degrees C. Option D. Capillary refill 3 seconds. The correct answer is option D. Capillary refill 3 seconds. Correct answer. Capillary refill 3 seconds. A capillary refill of 3 seconds is an optimal physical assessment finding and would be desired following the administration of PRBC. PRBC are indicated for clients with anemia hemoglobin less than 7g/dl. Giving a client PRBC improves tissue perfusion and may reflect the capillary refill finding. Question 91. The nurse is caring for a client who is prescribed enoxaparin. Which of the following findings in the medical history would require follow-up with the primary healthcare physician PHEP? Here are the options. Option A. Recent spinal surgery. Option B. Diabetes mellitus. Option C. Osteoarthritis. Option D. Venous thromboembolism. The correct answer is option A. Recent spinal surgery. Correct answer. Recent spinal surgery. Enoxaparin is an anticoagulant medication used to prevent blood clots. Clients who have recently undergone spinal surgery may be at risk for spinal epidural hematomas if they receive anticoagulation therapy like enoxaparin. This condition can lead to compression of the spinal cord and neurological deficits, necessitating consultation with the primary healthcare physician PHEP to assess the appropriateness of enoxaparin. Question 92. The nurse is teaching a caregiver how to administer an injection of enoxaparin. Which statement, if made by the caregiver, would require further teaching? Here are the options. Option A. I will give this injection in the abdomen. Option B. I should expel the air bubble before administering. Option C. Green leafy vegetables are allowed while taking this medication. Option D. This medication may increase the risk for bleeding. The correct answer is option B. I should expel the air bubble before administering. Correct answer. I should expel the air bubble before administering. This statement is incorrect and requires follow-up. Enoxaparin comes in prefilled syringes that are administered to the client subcutaneously. Since this medication comes in prefilled syringes, the air bubble should not be expelled. This is designed to remain next to the plunger to ensure the full dose is administered. Question 93. The nurse is reinforcing teaching to a client who is breastfeeding about ways to prevent mastitis. Which statement, if made by the client, would require follow-up? Here are the options. Option A. I will wear a tight-fitting bra to provide compression. Option B. I must wash my hands thoroughly before breastfeeding. Option C. I must change nursing pads as soon as they become wet. Option D. I need to feed my baby every 2-3 hours. The correct answer is option A. I will wear a tight-fitting bra to provide compression. Correct answer. I will wear a tight-fitting bra to provide compression. This statement is incorrect and requires follow-up. Tight bras can cause pressure on the breasts, making milk expression more difficult and leading to mastitis. Question 94. The nurse is caring for an 82-year-old with cancer. Due to the chemotherapy treatments, the client is unable to take in enough calories for his nutritional requirements. The provider orders a nasogastric NG tube to be inserted. Place the following actions in the order that the nurse takes to correctly insert the NG tube. Choices: lubricate the tip of the NG tube. Insert the NG tube in the nair, pushing it gently back and down toward the ear. Measure the length of the NG tube from the nose to the earlobe to the xiphoid process. Encourage the client to swallow a few sips of water and advance the NG tube past the oropharynx. Secure the NG tube at the pre-measured mark. Here are the options. Option A. Measure the length of the NG tube from the nose to the earlobe to the xiphoid process. Lubricate the tip of the NG tube. Insert the NG tube in the nair, pushing it gently back and down toward the ear. The correct answer is option A. Measure the length of the NG tube from the nose to the earlobe to the xiphoid process. Lubricate the tip of the NG tube. Insert the NG tube in the nair, pushing it gently back and down toward the ear. Correct answer. Measure the length of the NG tube from the nose to the earlobe to the xiphoid process. Lubricate the tip of the NG tube. Insert the NG tube in the nair, pushing it gently back and down toward the ear. Question 95. The practical nurse prepares to administer a cycled tube feed to a client through their NG tube. Before initiating the feed, which of the following actions does the nurse correctly take? Select all that apply. Choices: flush the nasogastric tube with saline. Verify placement of the nasogastric tube. Elevate the head of the bed. Ask the patient to remain in bed during the tube feeding. Here are the options. Option A. Flush the nasogastric tube with saline. Verify placement of the nasogastric tube. Elevate the head of the bed. The correct answer is option A. Flush the nasogastric tube with saline. Verify placement of the nasogastric tube. Elevate the head of the bed. Correct answer. Flush the nasogastric tube with saline. Verify placement of the nasogastric tube. Elevate the head of the bed. Question 96. The nurse is caring for a 26-year-old patient who is unable to meet their nutritional needs by mouth. The interdisciplinary team decides it would be best to insert an NG tube for enteral feedings. After inserting the tube, the nurse knows that which of the following is the most accurate way to verify the placement of the tube. Here are the options. Option A. Aspiration of stomach contents. Option B. pH verification of the aspirate. Option C. Auscultation of air in the LUQ when injected into the tube. Option D. Visualization on X-ray. The correct answer is option D. Visualization on X-ray. Correct answer. Visualization on X-ray. Visualization on X-ray is the gold standard for verification of nasogastric tube placement. This allows the radiologist to visualize the tip of the tube in the stomach and recommend any changes in placement that may be needed, such as pulling the tube back or advancing further. Question 97. The nurse is removing a nasogastric tube NGT. The nurse should take which action? Here are the options. Option A. Deflate the balloon. Option B. Irrigate the tube with 200 ml of water. Option C. Instruct the client to take a deep breath and hold it. Option D. Assess the gag reflex. The correct answer is option C. Instruct the client to take a deep breath and hold it. Correct answer. Instruct the client to take a deep breath and hold it. Prior to removing the NGT, it would be appropriate for the nurse to tell the client to take a deep breath and hold it as the tube is removed. The nurse should then pinch the tube and remove the tube quickly and steadily over 3-6 seconds while the client holds their breath or during exhalation. Question 98. Which of the following clients should the nurse assess first when preparing to do initial rounds? Here are the options. Option A. The client with diabetes that is being discharged today. Option B. A 32-year-old female with a tracheostomy that is experiencing copious secretions. Option C. A 16-year-old client that is scheduled for physical therapy this morning. Option D. An 80-year-old male with a decubitus ulcer that needs a dressing change. The correct answer is option B. A 32-year-old female with a tracheostomy that is experiencing copious secretions. Correct answer. A 32-year-old female with a tracheostomy that is experiencing copious secretions. The client with potential airway compromise should always be given the highest priority. Remember AB's airway, breathing, circulation. Copious secretions in a client with a tracheostomy can be a sign of airway obstruction or respiratory distress, which is considered a critical and potentially life-threatening situation. Question 99. The nurse is caring for a patient who had a fenestrated tracheostomy tube placed 1 week ago. Which of the following are true regarding fenestrated tracheostomies? Select all that apply. Choices. This type of tracheostomy does not require trache care. The patient with a fenestrated tracheostomy can speak. This is the only type of tracheostomy used with mechanical ventilation. A fenestrated tracheostomy can be capped if the cuff is deflated. Here are the options. Option A. The patient with a fenestrated tracheostomy can speak. A fenestrated tracheostomy can be capped if the cuff is deflated. Risks associated with fenestrated tracheostomies include bleeding, infection, accidental decannulation, removal of the tracheostomy tube, and difficulty breathing. The correct answer is option A. The patient with a fenestrated tracheostomy can speak. A fenestrated tracheostomy can be capped if the cuff is deflated. Risks associated with fenestrated tracheostomies include bleeding, infection, accidental decannulation, removal of the tracheostomy tube, and difficulty breathing. Correct answer. The patient with a fenestrated tracheostomy can speak. A fenestrated tracheostomy can be capped if the cuff is deflated. Risks associated with fenestrated tracheostomies include bleeding, infection, accidental decannulation, removal of the tracheostomy tube, and difficulty breathing. Question 100. The nurse is reviewing the laboratory results of assigned clients. Which of the following results would require immediate follow-up? Select all that apply. Choices: creatinine 2.7 mg/dl for a patient receiving vancomycin. Hemoglobin A1C of 6.9% for a patient with diabetes mellitus. Platelet count of 152 mm3 for a patient receiving methotrexate. Potassium 3.1 mg/dl for a patient receiving bumetanide. Here are the options. Option A: creatinine 2.7 mg/dl for a patient receiving vancomycin. Potassium 3.1 mg/dl for a patient receiving bumetanide. Calcium 10.8 mg/dl for a patient receiving hydrochlorothiazide. The correct answer is option A. Creatinine 2.7 mg/dl for a patient receiving vancomycin. Potassium 3.1 mg/dl for a patient receiving bumetanide. Calcium 10.8 mg/dl for a patient receiving hydrochlorothiazide. Correct answer: creatinine 2.7 mg/dl for a patient receiving vancomycin. Potassium 3.1 mg/dl for a patient receiving bumetanide. Calcium 10.8 mg/dl for a patient receiving hydrochlorothiazide. Question 101. The nurse has attended a staff education program about sources of negligent lawsuits. It would indicate effective understanding if the nurse identifies which of the following is a source of a negligent lawsuit. Here are the options. Option A: the nurse documents care under another nurse's username and password. Option B: the nurse takes pictures of a client's medical record and distributes them online. Option C: the nurse does not notify the physician of a client's critical laboratory result. Option D: the nurse treats their spouse in the acute care facility with prescribed medications. The correct answer is option C. The nurse does not notify the physician of a client's critical laboratory result. Correct answer: the nurse does not notify the physician of a client's critical laboratory result. Failure to document negligence is an unintentional tort and is defined as the failure of a person to exercise the degree of care that an ordinarily prudent person would have exercised under similar circumstances. This is deemed malpractice when the nurse is committing these infractions in a professional capacity. Malpractice is the failure of a professional person to act as other prudent professionals with the same knowledge and education would have acted under similar circumstances. The failure of the nurse to communicate with the physician a critical laboratory result in a timely manner is classic negligence/malpractice. Other examples of negligent acts include: Question 102. The nurse is caring for a client with pulmonary tuberculosis. Which action should the nurse take? Here are the options. Option A: place a box of disposable respirators inside the client's room. Option B: remove alcohol-based sanitizers from the client's room. Option C: assign the client to a private room with a positive airflow. Option D: remove the portable fan from the client's bedside table. The correct answer is option D. Remove the portable fan from the client's bedside table. Correct answer: remove the portable fan from the client's bedside table. For a client on either airborne or droplet precautions, the nurse should not allow and remove any portable fans, as these may propel pathogens and assist in disease transmission. If the client has a fever, non-pharmacological treatment options such as a cool compress or a tepid bath should be used. Question 103. The licensed practical/vocational nurse LPN/VN cares for a client with pulmonary tuberculosis TB. Which infection control measure should the LPN implement? Here are the options. Option A. Restrict visitors who are pregnant. Option B. Remove any portable fans in the room. Option C. Wear a dosimeter badge during client care. Option D. Place the patient further away from the nursing station. The correct answer is option B. Remove any portable fans in the room. Correct answer. Remove any portable fans in the room. Fans should be removed from a room for a client with droplet or fans may propel the transmission of a pathogen. A client with pulmonary tuberculosis should be isolated using airborne precautions. The door should be kept closed and the room should have monitored negative air pressure. Question 104. While monitoring a client with myocardial infarction who is receiving tissue plasminogen activator activase (TPA), the nurse should prioritize which of the following? Here are the options. Option A. Observe for neurological changes. Option B. Monitor for any signs of renal failure. Option C. Observe for signs of bleeding. Option D. Check the client's food diary. The correct answer is option C. Observe for signs of bleeding. Correct answer. Observe for signs of bleeding. Bleeding is the priority concern for any client who is taking a thrombolytic medication. Bleeding is a potential adverse effect of TPA therapy, and prompt recognition and intervention are crucial to prevent complications. Question 105. The nurse is caring for a client who has a fractured hip and has been on bed rest for a week. Which of the following symptoms would be considered signs of complications due to immobility? Select all that apply. Choices. The area is unable to be blanched on the client's sacrum. The client's skin has a faint yellow tinge. Crackles in the bases of the client's lungs. The client complains of pain, swelling, and tenderness in the left calf. Here are the options. Option A. The area is unable to be blanched on the client's sacrum. Crackles in the bases of the client's lungs. The client complains of pain, swelling, and tenderness in the left calf. The correct answer is option A. The area is unable to be blanched on the client's sacrum. Crackles in the bases of the client's lungs. The client complains of pain, swelling, and tenderness in the left calf. Correct answer. The area is unable to be blanched on the client's sacrum. Crackles in the bases of the client's lungs. The client complains of pain, swelling, and tenderness in the left calf. Question 106. The nurse is reinforcing education regarding the development of pressure ulcers. Which intrinsic risk factor should be included? Here are the options. Option A. Shearing. Option B. Friction. Option C. Impaired tissue perfusion. Option D. Pressure. The correct answer is option C. Impaired tissue perfusion. Correct answer. Impaired tissue perfusion. Poor nutritional status. Impaired tissue perfusion is an internal risk factor. Intrinsic refers to anything essential or belonging naturally. Other intrinsic risk factors associated with skin breakdown include. Question 107. The nurse has attended a continuing education presentation about acid-base imbalances. It would indicate a correct understanding of the conference if the nurse identifies which of the following is a cause for metabolic acidosis. Select all that apply. Choices. Severe diarrhea, starvation, nasogastric tube, and GT suctioning, hyperventilation. Here are the options. Option A. Severe diarrhea, starvation, end-stage renal disease, acid. The correct answer is option A. Severe diarrhea, starvation, end-stage renal disease, acid. Correct answer. Severe diarrhea, starvation, end-stage renal disease, acid. Hyperventilation. Question 108. The licensed practical/vocational nurse LPN/VN is caring for a client with the following clinical data. Which prescription would the LPN/VN request from the primary healthcare provider PHCP based on the clinical data? See the exhibit. Here are the options. Option A. Diphenhydramine. Option B. Lorazepam. Option C. Phenytoin. Option D. Clozapine. The correct answer is option B. Lorazepam. Correct answer, lorazepam. Lorazepam is a benzodiazepine used in the management of alcohol withdrawal symptoms. The client exhibits these symptoms evidenced by perspiration on the forehead, nystagmus, coarse tremors, and visual hallucinations. Question 109. The nurse is collecting data on a child with bilateral lower extremity chemical burns. The nurse suspects that the child may have been abused. The nurse should take which initial action? Here are the options. Option A. Cover the affected area with sterile dressing. Option B. Irrigate the affected area with saline. Option C. Report the suspected abuse. Option D. Document the findings. The correct answer is option B. Irrigate the affected area with saline. Correct answer. Irrigate the affected area with saline. A common mnemonic to remember is when a client has A. The highest priority is to copiously dilute it with saline or water. Prompt irrigation of the area exposed to caustic substances, acid, alkali. The chemical attempts to neutralize the pH change in the skin and decreases the extent of the dermal injury. Additionally, dilution lessens the risk of the caregiver getting burned by the chemical. Question 110. The nurse is discussing alcohol withdrawal with a group of nursing students. The nurse knows that the following components of alcohol withdrawal would be expected to go in what order? Choices: 1. Mild tremors. 3. Hyperthermia. 4. Hallucinations. 2. Delirium tremens. Here are the options. Option A. 1. Mild tremors. 2. Hyperthermia. 3. Hallucinations. The correct answer is option A. 1. Mild tremors. 2. Hyperthermia. 3. Hallucinations. Correct answer: 1. Mild tremors. 2. Hyperthermia. 3. Hallucinations. Question 111. The nurse is taking care of a client with encopresis. Which of the following statements correctly describe encopresis? Here are the options. Option A. Infrequent and hard-to-pass stools lasting greater than 2 weeks. Option B. Voluntary or involuntary fecal incontinence in children over the age of 4 who were previously toilet trained. Option C. Involuntary fecal incontinence in children over the age of 4 who were previously toilet trained. Option D. Inability to pass stool due to fecal impaction. The correct answer is option B. Voluntary or involuntary fecal incontinence in children over the age of 4 who were previously toilet trained. Correct answer: voluntary or involuntary fecal incontinence in children over the age of 4 who were previously toilet trained. Voluntary or involuntary fecal incontinence in children over the age of 4 who were previously toilet trained is the correct definition of encopresis. Question 112. Which of the following parenting styles is highly controlling, expecting always to be obeyed, and inflexible with the rules? Here are the options. Option A, authentic. Option B, permissive. Option C, authoritarian. Option D, indifferent. The correct answer is option C, authoritarian. Correct answer, authoritarian. The parenting style described as authoritarian. This parent is often described as the rigid disciplinarian. They are highly controlling, expect to always be obeyed, and are inflexible with the rules. Though these parents may have their child's best interests at heart, they do not support their growing autonomy. Instead, they expect to be obeyed without reason. Question 113. The nurse is educating a group of nursing students about fetal alcohol spectrum disorders FASTs. Which of the following features are characteristic of FAST? Select all that apply. Choices: intellectual disabilities, facial abnormalities, growth delays, motor impairments, anxiety. Here are the options. Option A, intellectual disabilities, growth delays, motor impairments. The correct answer is option A, intellectual disabilities, growth delays, motor impairments. Correct answer, intellectual disabilities, growth delays, motor impairments, anxiety. Question 114. The nurse is caring for a 2-day-old infant with fetal alcohol spectrum disorder FAST and is preparing the family for discharge. Which of the following educational points are essential to include? Select all that apply. Choices: emphasize the importance of avoiding alcohol consumption during future pregnancies. Educate the family about the potential long-term developmental and cognitive challenges associated with FAST. Here are the options. Option A, emphasize the importance of avoiding alcohol consumption during future pregnancies. Educate the family about the potential long-term developmental and cognitive challenges associated with FAST. Teach the family strategies for managing behavioral issues that may arise in the child with FAST. The correct answer is option A. Emphasize the importance of avoiding alcohol consumption during future pregnancies. Educate the family about the potential long-term developmental and cognitive challenges associated with FAST. Teach the family strategies for managing behavioral issues that may arise in the child with FAST. Correct answer: emphasize the importance of avoiding alcohol consumption during future pregnancies. Educate the family about the potential long-term developmental and cognitive challenges associated with FAST. Teach the family strategies for managing behavioral issues that may arise in the child with FAST. Behavioral issues are common in children with FAST. Equipping the family with strategies and techniques to manage and address these challenges can enhance their ability to support the child's well-being and development. Question 115. *NGN*. The nurse performs a home safety survey for an individual with epilepsy. Click to specify the findings that require intervention by the nurse. Choices: click to specify the findings that require intervention by the nurse. Tap to highlight and select the answer. Multiple feather pillows present on the bed. Padded covers on the edges of countertops. Multiple feather pillows are present on the bed. Here are the options. Option A, multiple glass tables in the living room. Multiple feather pillows present on the bed. Wall-to-wall carpeting was removed and replaced with scattered rugs on hardwood flooring. The correct answer is option A. Multiple glass tables in the living room. Multiple feather pillows present on the bed. Wall-to-wall carpeting was removed and replaced with scattered rugs on hardwood flooring. Correct answer: multiple glass tables in the living room. Multiple feather pillows present on the bed. Wall-to-wall carpeting was removed and replaced with scattered rugs on hardwood flooring. Seizure-safe pillows are available for sale as they reduce asphyxiation. Seizure-safe pillows should be used. The fewer pillows, the better to reduce the risk of asphyxiation. Question 116. An 8-year-old boy diagnosed with hemophilia is brought into the urgent care clinic for a prolonged episode of hematemesis. Which of the following describes this symptom? Here are the options. Option A: bleeding into the joints. Option B: bleeding from the nose. Option C: dark, black, tar-like stools. Option D: bloody vomit. The correct answer is option D: bloody vomit. Correct answer: bloody vomit. Hematemesis is bloody vomit. This symptom is common with hemophilia and can lead to severe complications if not treated promptly. Question 117. A nurse is caring for an adolescent with hemophilia who reports pain and joint bleeding after playing baseball. The nurse should prioritize the clients. Here are the options. Option A: acute pain. Option B: bleeding. Option C: self-esteem. Option D: knowledge deficit. The correct answer is option B: bleeding. Correct answer: bleeding. Addressing the client's active bleeding is the priority, as the client may develop shock if it goes untreated. Bleeding associated with hemophilia is often found in the joint space or at the point of physical injury. Question 118. The LPN is performing a breast exam on her 65-year-old client. If she were to find a malignant lump, where is the location she is most likely to find it? Here are the options. Option A: eye. Option B: Roman 2. Option C: Roman 3. Option D: Roman 4. The correct answer is option B: Roman 2. Correct answer: Roman 2. Quadrant Roman 2 is the outer, upper quadrant of the breast where malignant masses are most found. The breast tissue is thicker in the exterior, upper quadrant, and sometimes extends into the tissues surrounding the armpits. The nurse should pay close attention to palpation of this region of the breast. About 50% of breast cancer is detected in the upper outer quadrant UOQ. Question 119. What interventions should the nurse anticipate when providing care for a patient who has undergone repair of an aortal malformation? Select all that apply. Choices: Imodium administration, initiation of a high-calorie diet, Colace administration, initiation of a high-fiber diet. Here are the options. Option A: Colace administration, initiation of a high-fiber diet, monitor the client for signs of infection. The correct answer is option A: Colace administration, initiation of a high-fiber diet, monitor the client for signs of infection. Correct answer: Colace administration, initiation of a high-fiber diet, monitor the client for signs of infection. Question 120. The emergency department nurse is caring for a child who swallowed a toy. The child has trouble breathing but is conscious and not making any sounds. The nurse should. Here are the options. Option A: instruct the client to cough to clear the airway. Option B: apply a bag valve mask. Option C: perform abdominal thrusts. Option D: perform a blind finger sweep. The correct answer is option C: perform abdominal thrusts. Correct answer. Perform abdominal thrusts. Performing should be the first action to relieve the obstruction. This action is essential because the child has trouble breathing and is not making any noise after swallowing a toy, which indicates. Since this client has an upper airway obstruction, performing a blind finger sweep is not recommended as it may cause the object to propel further down the airway. The nurse should only attempt a finger sweep if the object is visible. Question 121. The LPN is working on the pediatric floor caring for a 2-year-old who receiving 100% FiO2 via a nasal cannula. At the end of her shift, the hospital receives a tornado warning. Which of the following actions should the nurse take to best protect her patient? Here are the options. Option A. Clock out, her shift is over and she is not responsible. Option B. Remove the nasal cannula and carry the child to a tornado shelter. Option C. Move the patient as close to the interior of the room as possible. Option D. Close all of the doors. The correct answer is option C. Move the patient as close to the interior of the room as possible. Correct answer. Move the patient as close to the interior of the room as possible. During a tornado warning, the appropriate nursing action is to move patients away from windows and as close to the interior of the room as they can safely be moved. This best protects them in the event of a tornado. Question 122. After experiencing a traumatic amputation and related body image disturbance, the nurse documents the nursing diagnosis of body image disturbance related to changes in appearance secondary to. Here are the options. Option A. Severe trauma. Option B. Loss of a body part. Option C. Chronic disease. Option D. Loss of body function. The correct answer is option B. Loss of a body part. Correct answer. Loss of a body part. Although the amputation was related to severe trauma, being specific about what type of injury, the loss of a body part gives precise information to other healthcare team members who may assume care of this client. The nursing diagnosis is body image disturbance. When referencing a nursing diagnosis secondary to a condition/experience, it is essential to be specific. Question 123. Which of the following food choices would be suitable for a client with iron deficiency anemia? Select all that apply. Choices: quinoa, liver, spinach, baked beans, dairy product. Here are the options. Option A. Quinoa, liver, spinach. The correct answer is option A. Quinoa, liver, spinach. Correct answer. Quinoa, liver, spinach. Beans are a good source of iron and an excellent recommendation for clients with iron deficiency anemia. There is about 5 mg of iron in 1 cup of baked beans. Question 124. Which of the following are clinical manifestations of the aging immune system that increase the susceptibility to illness? Here are the options. Option A. Increased lymph tissue. Option B. Increased autoimmune responses. Option C. Increased circulation of lymphocytes. Option D. Increased T and B cell production. The correct answer is option B. Increased autoimmune responses. Correct answer. Increased autoimmune responses. The elderly experience increased autoimmune responses. This increases the risk of diseases such as rheumatoid arthritis and other collagen disorders. Question 125. While working on the pediatric floor, you are assigned a client with impetigo. Which of the following actions do you take to prevent the spread of this disease? Here are the options. Option A. Initiate standard precautions. Option B. Initiate contact precautions. Option C. Initiate droplet precautions. Option D. Initiate airborne precautions. The correct answer is option B. Initiate contact precautions. Correct answer. Initiate contact precautions. Clients with impetigo need to be placed on to prevent the spread of this highly contagious disease. According to the CDC, these precautions are for clients who may be infected or colonized with specific infectious agents for which additional precautions are needed to prevent infection transmission. Contact precautions will be used for any disease in which direct contact with the infectious organism can cause illness. This includes impetigo and other conditions such as viral gastroenteritis, MRSA, and scabies. Contact precautions will be required before entering the room. A gown and gloves are donned. Question 126. The nurse is reinforcing teaching with the parents of a child diagnosed with impetigo. Which of the following statements, if made by the parent, would indicate effective understanding? Select all that apply. Choices. It is the most common bacterial skin infection between the ages of 2 and 5. The torso is the area most commonly affected by impetigo. The causative agent of impetigo is Haemophilus influenzae. Impetigo is usually not a systemic infection. I should keep my child home from swim practice until the blisters heal. Here are the options. Option A. It is the most common bacterial skin infection between the ages of 2 and 5. Impetigo is usually not a systemic infection. I should keep my child home from swim practice until the blisters heal. The correct answer is option A. It is the most common bacterial skin infection between the ages of 2 and 5. Impetigo is usually not a systemic infection. I should keep my child home from swim practice until the blisters heal. Correct answer. It is the most common bacterial skin infection between the ages of 2 and 5. Impetigo is usually not a systemic infection. I should keep my child home from swim practice until the blisters heal. I should not share my child's linens with anyone else in the house is another true statement. Linens are an effective way to transmit the bacteria, and they should not be shared and laundered daily to prevent reinfection. Question 127. The nurse is working with an advocacy group to raise awareness about cystic fibrosis. Which of the following statements does she know best explains the condition? Here are the options. Option A. It is an inherited disease that causes inflammation and hypersensitivity of the airway. Option B. It is an infectious disease causing inflammation and fluid accumulation in the alveoli of the lungs. Option C. It is an inherited disease causing excessive, thick mucus to build up in the body and cause blockages. Option D. It is an acquired disease that causes inflammation and swelling of the epiglottis. The correct answer is option C. It is an inherited disease causing excessive, thick mucus to build up in the body and cause blockages. Correct answer. It is an inherited disease causing excessive, thick mucus to build up in the body and cause blockages. This statement correctly describes cystic fibrosis as an inherited disease causing excessive, thick mucus to build up in the body and cause blockages. Question 128. The nurse is speaking with her patient, who is undergoing chemotherapy treatment. The patient states, "My friend beat cancer using complementary therapies. I think I should try that too." Which of the following responses from the nurse is most appropriate? Here are the options. Option A. Complementary therapies are not safe with your chemotherapy. Option B. I would be desperate if I had cancer too. Option C. Let us go get your healthcare provider so that we may discuss it with him. Option D. Tell me more about what you mean when you say complementary therapies. The correct answer is option D. Tell me more about what you mean when you say complementary therapies. Correct answer. Tell me more about what you mean when you say complementary therapies. This is the most therapeutic statement. Effective communication always begins with an open-ended statement. It addresses the question asked by the client and will lead to further discussion. The nurse should explore what therapies the client is interested in talking about first, so that she may better help the client when discussing the therapies with the healthcare provider. Question 129. Which of the following would the nurse expect to be administered to a newborn with respiratory distress syndrome (RDS)? Here are the options. Option A. Theophylline. Option B. Colfosirol. Option C. Dexamethasone. Option D. Albuterol. The correct answer is option B. Colfosirol. Correct answer, colfosirol. RDS respiratory distress syndrome is a type of neonatal respiratory disease most often caused by a lack of surfactant in the lungs. The fetal lungs start making surfactant during the third trimester of pregnancy, or around 26 weeks gestation through labor and delivery. Surfactant coats the alveoles insides, reducing the surface tension of fluid in the lungs and making the alveoli more stable. This keeps the lungs from collapsing when the newborn exhales. Question 130. Which of the following clients should the LPN/LVN attend to first? Here are the options. Option A. A client who is newly diagnosed with hepatitis that is reporting stomach pain and itchy skin. Option B. A patient in an arm cast that is 2 days post-op and reports feeling numbness and tingling in his affected arm. Option C. A post-op prostatectomy patient complaining of bladder spasms and blood in his Foley bag. Option D. A patient with a newly placed NG tube complaining of pain around the face and a plugged nose. The correct answer is option B. A patient in an arm cast that is 2 days post-op and reports feeling numbness and tingling in his affected arm. Correct answer. A patient in an arm cast that is 2 days post-op and reports feeling numbness and tingling in his affected arm. Numbness and tingling hours or days after a cast is applied may indicate and should be reported to a doctor right away. Question 131. The nurse is caring for a patient who is experiencing acute mania. Which of the following actions should be prioritized by the nurse? Here are the options. Option A. Plan structured solitary activities. Option B. Redirect the patient's speech and ideas. Option C. Provide high-calorie, small, frequent meals. Option D. Initiate a psychiatry referral. The correct answer is option C. Provide high-calorie, small, frequent meals. Correct answer. Provide high-calorie, small, frequent meals. A client experiencing acute mania manifests symptoms such as inflated self-esteem, flight of ideas, psychomotor agitation, and an expansive affect. The client experiencing mania often has difficulty sleeping and exerts excessive physical energy. Thus, the nurse needs to focus on ensuring that the client's need for nutrition is met by offering high-calorie, small, frequent meals. This is the priority based on Maslow's hierarchy of needs. Question 132. The practical nurse is informed in report that her client is at risk for developing hypercalcemia. The nurse should monitor for which of the following signs and symptoms of hypercalcemia. Select all that apply. Choices: irritability, decreased deep tendon reflexes, palpitations, hypoactive bowel sounds. Here are the options. Option A: hypoactive bowel sounds, decreased deep tendon reflexes, palpitations. The correct answer is option A. Hypoactive bowel sounds, decreased deep tendon reflexes, palpitations. Correct answer: hypoactive bowel sounds, decreased deep tendon reflexes, palpitations. Hypoactive bowel sounds. Question 133. The nurse is preparing to perform a fetal non-stress test on a patient who is 34 weeks pregnant. Which action would be most important for the nurse to perform prior to this procedure? Here are the options. Option A: explain the possible risk of inducing early labor. Option B: confirm the patient's NPO status for at least 4 hours prior to the test. Option C: administer oxytocin to stimulate uterine contraction. Option D: position the patient in Sims position. The correct answer is option D. Position the patient in Sims position. Correct answer: position the patient in Sims position. The nurse should instruct the patient to void prior to the test, then assist her into the left-lying Sims position to promote optimal oxygen delivery to the fetus. Question 134. Which of the following is the accurate education for injury prevention in the home of elderly clients? Here are the options. Option A: use the handrail when going up and down the stairs, ensure robes or pants are held up if flowy, and wear comfortable slippers. Option B: remove all throw rugs, remove furniture from all pathways, and wear comfortable non-skid footwear. Option C: use solid chairs without armrests, keep walkways clear, use cordless phones. Option D: install raised toilet seats, ensure that all sinks have throw rugs to prevent slipping on water, and use grab bars in the shower/bathroom. The correct answer is option B. Remove all throw rugs, remove furniture from all pathways, and wear comfortable non-skid footwear. Correct answer: remove all throw rugs, remove furniture from all pathways, and wear comfortable non-skid footwear. Elderly individuals are more susceptible to falls due to age-related changes in balance, muscle strength, and vision. Removing throw rugs and clearing pathways of furniture helps eliminate tripping hazards, reducing the likelihood of falls and related injuries. Question 135. The nurse is caring for a client with borderline personality disorder. Which of the following actions should the nurse take? Select all that apply. Choices: assess the patient for suicide, establish therapeutic boundaries, encourage social relationships, encourage independent decision-making. Here are the options. Option A: assess the patient for suicide, establish therapeutic boundaries, refer the patient for therapy. The correct answer is option A. Assess the patient for suicide, establish therapeutic boundaries, refer the patient for therapy. Correct answer: assess the patient for suicide, establish therapeutic boundaries, refer the patient for therapy, encourage independent decision-making. Question 136. The nurse cares for a client receiving 1,300 units/HR of heparin. The bag is labeled 25,000 units and 500 ml of dextrose 5% in water. How many ml should the nurse record that the client received in 8 hours? Choices. Next, take the ml/HR the client is receiving and multiply it by 1,300 units/25,000 units x 500 ml equals 26 ml. 26 ml x 8 hours equals. Here are the options. Option A, 208 ml. The correct answer is option A, 208 ml. Correct answer, 208 ml. Question 137. The nurse is discharging a client following knee arthroplasty. Which of the following information should the nurse reinforce in the discharge teaching? Here are the options. Option A. After this procedure, you will use a wheelchair to get around. Option B. You will need to resume your anticoagulants. Option C. Placing a pillow under your knee will help with the pain. Option D. You may ice the site for 1 hour at a time. The correct answer is option B. You will need to resume your anticoagulants. Correct answer. You will need to resume your anticoagulants. Following a knee arthroplasty, the clients will not be as mobile and require crutches. This may increase their risk of developing VTE. Thus, the nurse should reiterate that the clients resume their prescribed anticoagulants or initiate them if they are newly prescribed. Evidence-based guidelines recommend that clients undergoing total hip or total knee arthroplasty receive anticoagulant prophylaxis for a minimum of 14 days. Question 138. A nurse is caring for a client with heart failure. Which of the following interventions should the nurse implement to manage fluid volume overload? Select all that apply. Choices. Administer diuretics as prescribed. Restrict fluid intake to 500 ml per day. Encourage high sodium diet. Monitor daily weights. Here are the options. Option A. Administer diuretics as prescribed. Monitor daily weights. Collect data on the client's lung sounds for crackles. The correct answer is option A. Administer diuretics as prescribed. Monitor daily weights. Collect data on the client's lung sounds for crackles. Correct answer. Administer diuretics as prescribed. Monitor daily weights. Collect data on the client's lung sounds for crackles. Monitor daily weights. Question 139. Although you were informed that your assigned client has no special skincare needs, you observe reddened areas over bony prominences upon your assessment. What is the next appropriate action? Here are the options. Option A. Correct the initial assessment form. Option B. Redo the assessment and document the current findings. Option C. Conduct and document an emergency assessment. Option D. Perform and document a focused assessment of skin integrity. The correct answer is option D. Perform and document a focused assessment of skin integrity. Correct answer. Perform and document a focused assessment of skin integrity. Performing and documenting a focused assessment of skin integrity is appropriate, since this is a newly identified problem. Question 140. When the nurse begins to irrigate a Salem sump tube, she notices that the gastric drainage is dark brown. What is the first intervention the nurse should take? Here are the options. Option A. Perform a hemoccult test on the contents. Option B. Irrigate the tube and check the returns. Option C. Remove the tube from the suction. Option D. Check the pH of the gastric contents. The correct answer is option A. Perform a hemoccult test on the contents. Correct answer. Perform a hemoccult test on the contents. The presence of dark brown drainage may indicate the presence of bleeding or blood in the GI tract. The first nursing intervention is to perform a hemoccult test to determine the presence of blood. Question 141. The nurse is caring for assigned clients. The nurse should recognize that the client at greatest risk for postpartum hemorrhage PPH is the client who has which of the following? Here are the options. Option A, uterinotony and delivered with the assistance of forceps. Option B, postpartum urinary incontinence and diuresis. Option C, an active outbreak of genital herpes and had a cesarean section. Option D, gestational diabetes and has postpartum hyperglycemia. The correct answer is option A, uterinotony and delivered with the assistance of forceps. Correct answer, uterinotony and delivered with the assistance of forceps. Uterinotony is the most common cause of PPH. This is when the uterus fails to contract after delivery. Additionally, delivery with the use of instruments such as forceps raises the risk of PPH because of the trauma that may be caused by the instruments. Question 142. Which action should the nurse take to most effectively reduce the incidence of hospital-associated urinary tract infections? Here are the options. Option A, delegate perineal hygiene to unlicensed assistive personnel. Option B, review intake and output I&O charting for fluid imbalances. Option C, minimize the use of an indwelling urinary catheter. Option D, request random urine analysis UA from the primary healthcare provider. The correct answer is option C, minimize the use of an indwelling urinary catheter. Correct answer, minimize the use of an indwelling urinary catheter. The most effective way to reduce the incidence of UTIs is to avoid using invasive urinary catheters. These types of catheters should be limited in their use and removed as soon as possible. Studies have demonstrated that bacteria can start to colonize about 48 hours following the insertion. Question 143. The nurse is triaging phone calls in the prenatal clinic. The nurse should follow up on the client who is. Here are the options. Option A, 16 weeks of gestation and reports a fluttering sensation. Option B, 30 weeks of gestation and reports perineal itching and bright red blood in the stool. Option C, 28 weeks of gestation and reports intermittent leg cramping with swelling in her feet. Option D, 38 weeks of gestation and reports lower back pain that increases with walking. The correct answer is option D, 38 weeks of gestation and reports lower back pain that increases with walking. Correct answer, 38 weeks of gestation and reports lower back pain that increases with walking. These manifestations indicate that the client may be beginning labor. True labor manifestations include contraction patterns of increasing frequency, duration, and intensity. The contractions tend to increase with walking and may start in the lower back and gradually sweep around to the lower abdomen. Considering the client's gestational age and manifestations, this client requires immediate follow-up. Question 144. The nurse knows that which of the following are possible causes of constipation in the pediatric client? Select all that apply. Choices: Hirschsprung disease, spina bifida, iron supplements, psychosocial factors, changes in routine. Here are the options. Option A, Hirschsprung disease, spina bifida, iron supplements. The correct answer is option A, Hirschsprung disease, spina bifida, iron supplements. Correct answer, Hirschsprung disease, Spina bifida. Iron supplements. Changes in routine are a medication that commonly causes constipation. It is one of their most common side effects. Clients should be educated about the side effect and measures to prevent constipation. Sometimes a bowel regimen may be necessary. Question 145. A client in a post-anesthesia care unit is semi-conscious and dyspneic. What should the nurse's first action be? Here are the options. Option A. Place a pillow under the client's head. Option B. Remove the oropharyngeal airway. Option C. Administer oxygen by mask. Option D. Reposition the client to keep the tongue forward. The correct answer is option D. Reposition the client to keep the tongue forward. Correct answer. Reposition the client to keep the tongue forward. The tongue can obstruct the airway of a semiconscious client. Repositioning in the sideline position with the face slightly down will prevent occlusion of the pharynx and allow the drainage of mucus from the mouth. Question 146. While reviewing a client's medication list, the nurse understands which prescribed medications are classified as calcium channel blockers. Select all that apply. Choices: nifedipine, propranolol, verapamil, hydralazine, digoxin. Here are the options. Option A. Nifedipine, verapamil. The correct answer is option A. Nifedipine, verapamil. Correct answer: nifedipine, verapamil. Nifedipine and verapamil are calcium channel blockers (CCBs). Other CCBs include amlodipine, nicardipine, felidipine, and diltiazem. CCBs are broadly classified into dihydropyridine and non-dihydropyridine classes. The dihydropyridine calcium channel blockers ending with the suffix dipine are more. They cause systemic vasodilation and are used to decrease blood pressure, treat hypertension. Question 147. While working in the emergency department's resuscitation area, EMS notifies you that a 7-year-old male with an avulsion fracture to the left tibia is 20 minutes out. You know to expect which of the following? Here are the options. Option A. A fracture that pulls a part of the bone from the tendon or ligament. Option B. A fracture with which the whole cross-section of the bone is fractured. Option C. A fracture that results from an underlying disease or disorder, not physical trauma or stressors. Option D. A fracture that affects only one side of the bone. The correct answer is option A. A fracture that pulls a part of the bone from the tendon or ligament. Correct answer: a fracture that pulls a part of the bone from the tendon or ligament. An avulsion fracture pulls a part of the bone from the tendon or ligament. Fractures are a common occurrence and clients often present to the emergency department. A nurse should be able to recognize different types of bone fractures and plan for appropriate nursing intervention. Question 148. The nurse plans care for a client admitted with type B meningitis. When caring for this client, the nurse should gather which appropriate personnel protective equipment PPE. Here are the options. Option A. Boot shoe covers. Option B. Face shield. Option C. Surgical mask. Option D. Gown. The correct answer is option C. Surgical mask. Correct answer: surgical mask. Haemophilus influenzae, type B meningi requires droplet precautions. Droplet precautions require the nurse to don a surgical mask upon entry to the client's room. Cohorting with droplet precautions is permitted as long as the other individual has the same pathogen. Clients who require transport or want to ambulate outside their room should don a surgical mask. Question 149. The nurse is admitting a child diagnosed with epiglottitis. During her admission questions, which vaccination should the nurse specifically ask the mother about? Here are the options. Option A, Tdap. Option B, influenza. Option C, Hib. Option D, The correct answer is option C, Hib. Correct answer, Hib. Hib Haemophilus influenzae type B is the most common cause of the bacterial infection that causes epiglottitis. Incidence has been significantly decreased by the Hib vaccine. That is why the nurse should ask the mother about this vaccination during the admission questions. Question 150. The licensed practical/vocational nurse LPN/VN is participating in a quality improvement project to reduce urinary tract infections (UTIs) for older adult clients in long-term care. It would be appropriate for the nurse to recommend select all that apply. Choices: the addition of more liquids to meal trays, standardizing the dosing times of prescribed diuretics, audio reminders for turning bedbound clients, daily bathing using bath basins. Here are the options. Option A, the addition of more liquids to meal trays, a staff and service on hand hygiene. The correct answer is option A, the addition of more liquids to meal trays, a staff and service on hand hygiene. Correct answer, the addition of more liquids to meal trays, a staff and service on hand hygiene. A significant intervention the nurse can implement to reduce UTIs in older adults is offering more liquids. The older adult has a reduced thirst reflex, and this reduced reflex may cause the client to experience a fluid volume deficit, which is a major precipitating factor in the development of a UTI. Offering more fluids during mealtime and in between meals is effective in mitigating UTIs. Hand hygiene is an effective intervention in curbing healthcare-acquired infections, including UTIs. This would be an appropriate recommendation. Question 151. The nurse is caring for a postoperative client at risk for venous thromboembolism (VTE). The nurse anticipates that the primary healthcare provider (PHCP) will prescribe which medication? Here are the options. Option A, enoxaparin. Option B, verapamil. Option C, tranexamic acid. Option D, ropinirole. The correct answer is option A, enoxaparin. Correct answer, enoxaparin. Enoxaparin is a low molecular weight-based heparin LMWH indicated for VTE prophylaxis following surgery. This medication is only given subcutaneously in the abdomen. Question 152. During a busy shift, the nurse appropriately delegates tasks to the unlicensed assistive personnel UAP working with her. After delegating, which is the nurse's primary responsibility? Here are the options. Option A, document the completion of the task. Option B, make a list of tasks not yet completed to pass on to the next shift. Option C, observe the UAP for the duration of the task. Option D, follow up with the UAP to ensure completion of the task by evaluating the outcome. The correct answer is option D. Follow up with the UAP to ensure completion of the task by evaluating the outcome. Correct answer. Follow up with the UAP to ensure completion of the task by evaluating the outcome. The nurse should follow up with the unlicensed assistive personnel UAP to ensure completion of the task, evaluating the outcome. The ultimate responsibility for any task will always remain with the person who delegated it. Therefore, after delegating a task, the nurse's primary responsibility will be to follow up with the UAP. Question 153. The nurse is teaching a new group of nurses about insulin administration for a client with type 1 diabetes mellitus. Which of the following points should be included? Select all that apply. Choices: administer insulin subcutaneously, not intramuscularly. Regular insulin can be administered intravenously in emergency situations. Rotate injection sites to prevent lipohypertrophy. Long-acting insulin should not be mixed with other types of insulin. Here are the options. Option A: administer insulin subcutaneously, not intramuscularly. Regular insulin can be administered intravenously in emergency situations. Rotate injection sites to prevent lipohypertrophy. The correct answer is option A. Administer insulin subcutaneously, not intramuscularly. Regular insulin can be administered intravenously in emergency situations. Rotate injection sites to prevent lipohypertrophy. Correct answer: administer insulin subcutaneously, not intramuscularly. Regular insulin can be administered intravenously in emergency situations. Rotate injection sites to prevent lipohypertrophy. Long-acting insulins glargine and detemir should not be mixed with other insulins in the same syringe due to their pH or potential for precipitation, which could affect their action. Question 154. The LPN is caring for several clients with diabetes. The LPN should recognize that the clients at risk for hypoglycemia include which of the following? A client: select all that apply. Choices: who has diabetic ketoacidosis and is receiving continuous regular insulin intravenously. Who is receiving methylprednisolone for an exacerbation of asthma. Who has pancreatitis and is receiving total parenteral nutrition TPN. Who is nothing by mouth and PO status following a coronary artery bypass graft CABG. Who received 6 units of Lispro insulin 1 hour ago and has not eaten. Here are the options. Option A: who has diabetic ketoacidosis and is receiving continuous regular insulin intravenously, who received 6 units of Lispro insulin 1 hour ago and has not eaten. The correct answer is option A. Who has diabetic ketoacidosis and is receiving continuous regular insulin intravenously, who received 6 units of Lispro insulin 1 hour ago and has not eaten. Correct answer: who has diabetic ketoacidosis and is receiving continuous regular insulin intravenously, who received 6 units of Lispro insulin 1 hour ago and has not eaten. A client with diabetic ketoacidosis DKA receiving regular insulin intravenously is at significant risk for hypoglycemia because regular insulin, when given intravenously, peaks within 15 to 30 minutes. This is why the client has their glucose taken every hour. Lispro insulin is rapid-acting, and if the client has not eaten within 10 to 15 minutes of getting the insulin, they run the risk of hypoglycemia. Question 155. A cardiac intensive care unit nurse is caring for a client who underwent a coronary artery bypass graft CABG 24 hours ago. The nursing care plan indicates a nursing diagnosis of decreased cardiac output related to alterations in cardiac contractility. Based on the formulated nursing diagnosis, which nursing intervention should be implemented in the nursing care plan? Here are the options. Option A: monitor the client's arterial blood gas ABG continuously. Option B: monitor the client's weight daily and calculate the change. Option C: administer prescribed opioids. Option D: Monitor mediastinal chest tubes for hourly output. The correct answer is option B. Monitor the client's weight daily and calculate the change. Correct answer: monitor the client's weight daily and calculate the change. Monitoring the daily weight of the client and noting any changes provides the nurse with a picture of the client's fluid volume status, which is influenced by the client's cardiac output. Weight is the most reliable indicator of fluid gain and loss. Question 156. A nurse has received orders to administer a rhodium injection IM to a postpartum client. Which situation is not a contraindication for the administration of this injection? Choices: administration to a client who has a history of a systemic allergic reaction to preparations containing human immunoglobulins. Administration of the injection within 72 hours after delivery. Administration to an Rh-positive female client. Administration to a client with an elevated temperature. Here are the options. Option A. Administration of the injection within 72 hours after delivery. The correct answer is option A. Administration of the injection within 72 hours after delivery. Correct answer: administration of the injection within 72 hours after delivery. The injection should be given within 72 hours after birth. Rhodium is administered intramuscularly within 72 hours after birth to prevent sensitization to the Rh factor in an Rh-negative woman with an Rh-positive infant. This injection will prevent hemolytic disease in subsequent pregnancies. Each vial of rhodium is cross-matched to a specific woman. The nurse must do all appropriate checks for client identification to avoid an error in administration. Question 157. The primary healthcare provider PHCP prescribes ondansetron 2.15 mg/kg Roman 4 to a pediatric client who weighs 40 lb. The medication label reads 2 mg/ml. How many milliliters will the nurse administer to the client? Choices: fill in the blank. Round the answer to the nearest tenth. Next, determine the prescribed dose. Here are the options. Option A. 40 pounds/2.2 kg equals 18.18 kg. The correct answer is option A. 40 pounds/2.2 kg equals 18.18 kg. Correct answer: 40 pounds/2.2 kg equals 18.18 kg. 40 pounds/2.2 kg equals 18.18 kg. Question 158. The nurse is caring for a client that is prescribed a calcium channel blocker CCB for hypertension. When reinforcing education about the medication, the nurse knows that which of these foods should be avoided. Here are the options. Option A. Eggs. Option B. Milk. Option C. Grapefruit. Option D. Bananas. The correct answer is option C. Grapefruit. Correct answer: grapefruit. Grapefruit and its juice contain phenocalmerins, which block the enzymes involved in metabolizing many drugs, including calcium channel blockers. Grapefruit can interfere with other drugs too, including statins, atorvastatin, lovastatin, simvastatin, some antibiotics, and some cancer drugs. Medication blood levels can increase, resulting in toxicity. The calcium channel blockers levels are increased when grapefruit or grapefruit juice is consumed, potentially causing hypotension. Question 159. A nursing assistant tells the nurse that her client with COP did not get his annual flu shot this year and has not had a pneumonia vaccination. The CNA should report which finding to the nurse immediately. Here are the options. Option A. Blood pressure of 150/80 mm/Hg. Option B. Respiratory rate of 26 breaths/min. Option C. The heart rate of 92 beats/min. Option D. Oral temperature of 101.4 degrees F. The correct answer is option D. Oral temperature of 101.4 degrees F. Correct answer. Oral temperature of 101.4 degrees F. An elevated temperature indicates some form of infection, possibly respiratory in origin. A client who did not receive pneumonia or influenza vaccine is at increased risk of developing pneumonia and influenza. Monitoring for signs/symptoms of infection is a crucial nursing intervention. Question 160. The charge nurse must transfer a client from the maternity unit to the medical surgical unit to make a bed available. It would be most appropriate for the nurse to transfer the client who is. Here are the options. Option A. Experiencing preterm contractions and requires continuous monitoring for potential preterm labor. Option B. Postpartum following a cesarean section and needs close observation for surgical wound healing and pain management. Option C. Admitted for preeclampsia and is experiencing a frontal headache. Option D. In her second trimester, undergoing evaluation for suspected gestational diabetes and requires a non-stress test. The correct answer is option B. Postpartum following a cesarean section and needs close observation for surgical wound healing and pain management. Correct answer. Postpartum following a cesarean section and needs close observation for surgical wound healing and pain management. The most appropriate client to transfer from the maternity unit to the medical surgical unit to make a bed available is the client who is postpartum after delivering her baby via cesarean section and needs close observation for surgical wound healing and pain management. Question 161. When providing care for a client with known Roman IV drug use, which statement would be appropriate for the nurse to highlight this behavior's risk factors? Here are the options. Option A. The use of these drugs can increase the risk of contracting diseases due to immunosuppression. Option B. Roman IV drug use can lead to skin infections at injection sites and poor health. Option C. The risk of contracting and/or spreading blood-borne pathogens such as HIV, which can progress to AIDS, is a huge risk factor with this activity. Option D. Drug use can lead to unsafe sex practices, increasing the risk of transmission of sexually transmitted diseases/infections. The correct answer is option C. The risk of contracting and/or spreading blood-borne pathogens such as HIV, which can progress to AIDS, is a huge risk factor with this activity. Correct answer. The risk of contracting and/or spreading blood-borne pathogens such as HIV, which can progress to AIDS, is a huge risk factor with this activity. Roman IV drug use involves sharing needles, which significantly increases the risk of transmitting blood-borne pathogens such as HIV, hepatitis B, and hepatitis C. These infections can lead to severe health consequences, including the progression to AIDS for individuals infected with HIV. Question 162. The nurse prepares a client for a scheduled percutaneous coronary intervention (PCI). Which client's statement should be reported to the primary healthcare provider (PHCP)? Here are the options. Option A. I took my metformin this morning. Option B. I get anxious when I'm in closed spaces. Option C. I am allergic to shellfish. Option D. I may feel a warm sensation during the procedure. The correct answer is option A. I took my metformin this morning. Correct answer. I took my metformin this morning. This procedure involves intravenous Roman 4 contrast, and a small chance of acute kidney injury may occur when Roman 4 contrast is given within 48 hours of metformin. Thus, the PHCP needs to be notified. Exposure to metformin prior to this procedure is not a contraindication, but requires Roman 4 fluids to decrease the negative effects on the kidneys.